Good morning. Welcome to class 1 of the 4-week CNA Test Prep program. We're going to get you all ready for the state exam, the CNA state exam. Today, we're going to cover foundation principles, things like what is a CNA? What do they do? How does the test work? What do I need to know? We're going to cover things like the opening, which is how every skill starts, the closing, which is how every skill ends, and we're going to cover hand washing as well. So a lot of very foundational principles are going to be covered today. We're going to be reviewing at the beginning of each class from here on. So everything you're going to learn today in 4 hours, I'm going to review with you in about 30 minutes in the next class. So we do this to build on what we're learning, okay? So everything on the back wall, these are our building blocks. These are called the principles. This is what we're going to be learning in the class, and you will master all of these by the second week. You're not going to go home and memorize anything, okay? We're going to learn. There's a difference between memorizing and learning. All of you guys memorized the Gettysburg Address in 4th grade. Do you remember it? No, because it's not relevant, okay? That was memorization. You remembered something for a short time, you got your grade, it went away. That's not what we need for CNA work. What we need for CNA work is to learn these principles because we don't want to forget them. We want to apply them over and over. So there's a little bit of a difference between memorizing and learning. And my focus is to get you to learn. So the way that I present the information is presented with that goal in mind. Okay. If you find yourself falling behind, if you find yourself going, I don't get that, I don't understand it, let me know. This is your class. I'm just here to facilitate it. So if you need something from me, let me know, and I'd be happy to help. Good? Good. So for those of you who don't know who I am, my name is Patricia Laramee. I'm an RN. I have been a nurse for more years than you guys have been alive. A very long time. And I love what I do. Now, I'm in full-time education now. I am a subject matter expert in CNA testing, which means people from all over the country call and ask me questions about how the CNA test works. And that's important for you because I have spent the last 20 years of my career learning what's required on the test, why certain things are graded the way that they are, and how to maximize your own performance to make sure that you pass on the first try. Now, we're much bigger than what we look like in Spring Hill, right? Spring Hill's so small, right? We got this little small room and a little small place, but we actually are the #1 channel on YouTube for CNA training. And that's what we have on that back wall, that camera. We are now live streaming out to YouTube as well as our social media channels. And we have people that are tuning in to watch. These are people that maybe are in Florida and just want to get free training to be able to challenge a state exam. We have some of those on there. We also have people from other states who are looking to gain a little bit more confidence before they go test. We have some of those up here too. And then we also have some people internationally that want to see how CNA training in America is different from CNA training in their country. And it's very interesting because that term CNA is not universal. It is not used throughout the country, or I'm sorry, throughout the world. Different countries handle CNAs a little bit differently. And America is actually one of the few that certify direct caregivers. It's not certified in many other countries. So there's a lot of people that join just to find out what makes us a little different. So that's who I am and where we're going. This class is going to be held on Mondays and Wednesdays. Please don't come tomorrow. I will not be here. It's not Monday through Wednesday. It's Monday and Wednesday from 9 to 1 for 4 weeks. And guys, that 4 weeks is going to go fast, way faster than you think it will. You're going to be sitting here in 4 weeks going, oh my gosh, we graduate like next class. Oh my gosh. So try not to get too behind on the homework because there's not a whole lot of time to get caught up if you get behind. So try to carve out as much time as you can to keep up with the class in these 4 weeks. Okay, good. You can attend in person. That's you guys here in this room. You physically come and we welcome you. Or you can attend virtually through the camera. Now, if you attend virtually through the camera on our YouTube channel, so let's say you wake up on Wednesday morning, you've got a flat tire, you can't get here, just go to my YouTube channel and click live, and there I am. And you're just like you're sitting here. It's the same words, it's through the camera. And if you type a comment in on YouTube, and it's a question that Jake thinks needs to be answered. This is Jake. Here we go. This is Jake. He handles all my tech. If a question comes in that Jake thinks I need to handle, he throws it up on the screen just like this. So you can be at home in your pajamas, attending class, type in your question. It comes up on the screen. I see it and I answer it just like you were physically here. And that's a big benefit to you so that if you can't physically come to class, you still have a way of attending. Now, what makes that even more powerful is, do you guys remember I said I was going to talk for 4 hours straight, right? That's a lot of words, and you're not going to remember all of them. You're not. So when you get home tonight or tomorrow morning and you're thinking about class and you're like, oh, I know she said something about that, but I can't remember what it was. Well, then you can go onto our live stream page, which is the same page that you signed up for class on, flcnatraining.com. Go onto that page, scroll down below the books, and you'll actually see the live stream that's coming up. And below that are the replays of the ones that we've completed. So after class today at 1 o'clock, you will see the replay of this class right here that we're in. So at 1:15, you can rewatch this entire session if you want to. Put it on double speed. Okay. So those are available for you as a way of reviewing. Good? Questions? So a lot of ways for you to get the content. And I'm not done. We still have a whole lot more to go. But we're going to stop there for now. This is our website, flcnatraining.com, that hosts our live stream as well as our replays. Now, if you're watching the live stream on here, it'll show up in a big box. You can watch the live stream. But the problem is that you can't put comments in because it's just a feed from YouTube. You just click the little YouTube logo in the bottom. It takes you to YouTube, and then you can ask your questions directly on YouTube. Good? Make sense? Okay. We do give you review worksheets at the end of each class. So right about 1 o'clock, Jake's going to walk around, hand out a worksheet that's going to sum up everything that we went over today. These are powerful, powerful. If you fill out that worksheet at the end of every class, that becomes a review packet right before you test. So it condenses the information into something that's easily reviewable. And our students are getting fantastic results using those review sheets right before they test. It just reminds them of all of those important principles. So those review sheets, fill them out and keep them. They're going to be very important to you when you go test. Good? Good? All right. We also send out a wrap-up email at the end of every class. So what that means is that you will get an email to your email address, actually. That reminds me. Okay. So this, I'm going to be sending around in just a few moments. This has your name and your email address according to the records that we have. Please make sure that your name is spelled correctly. I do sometimes have typos. And make sure that your email address is correct. If it is, just write okay in the space so I know you saw it. If it's not, if I need to correct either your name or your email, write the corrected one out in your very best handwriting so I can read it. Good? And then we'll correct it. That way we can make sure that you get those wrap-up emails. Those wrap-up emails will have links to the videos that we're watching in class, to additional training materials that you have access to, All of that will be in those wrap-up emails, so you want to be able to have access to that. Did everybody get our email that went out yesterday? Everybody get the email? If you did not get the email, check your spam folder and your promotion folder. If you still didn't get your email, see Jake after class. I'm going to pass this around. Please make sure you check it. Start there. All right. You also will get free access to the online CNA Test Prep course, which we'll talk about in a little while. In front of you, you have 2 books. We're not going to go into these books in detail at the moment. We are after break. We'll go into how they work. But for right now, I need you to understand the difference between the 2. So you have a yellow book, and you have what we call the class book or the spiral book. This is your skills book. So you have 2 books. The one we work out of in class is this one, the spiral book. The yellow book, you're going to take home with you and leave it there for the next 4 weeks. Bless you. You'll bring it back to me on the last day of class. We loan that book to you. It goes home with you. You use it at home, but we don't work out of it in class. Because it's for homework reading. It is not for skills-based learning. Okay? So the yellow book goes home with you, stays home. We're going to use it for reading. But in class, everything that I'm going to talk about, remember I said that I took notes for you? All of those are going to be found in the skills book. This book is yours. You can write in it. You can color it. You can eBay it. You can burn it. It's yours. Do with it what you will. But remember, the yellow one is going to come back to me. Good? So before we get started, we're going to turn to page 17 in your spiral book. We're going to get there. We're going to get there. Good morning. Good morning. If you want to find your t-shirt here on the front table and then just have a seat, I think the books are over there in that back table. Okay, so if you look at page 17, you can see the very first banner. So if you look over here, remember I said we're going to learn all of the things on the back wall in the first 2 weeks. We're going to start with the very first one, skill rules. This is what it looks like. So this is what we're going to be learning first. Now, this is going to apply to every single skill that we're going to learn in class. For those of you who don't know how this works, on the state exam, you are going to take a written test on the computer. That's kind of a test that we're all used to, written test on the computer. But you also have to demonstrate 3 clinical skills in front of 2 RN evaluators for the clinical portion of the test, which means you have to learn some skills. And there's 21 skills that you're going to learn in class, and they're going to select 3 of those for you to demonstrate to them. Okay. So in order to learn how to do these skills, we have to go over the foundation or skill rules. So if you look on this page, this is how we introduce all of the principles. You'll see down here what the principle is on our banner. You'll see the steps involved in that principle, and then you'll see the skills that that principle applies to. Down here shows you that I have a video for this. Pages 17, you can see that here as well. And then if you go to 18, the next page, you'll see the notes for what I'm about to tell you. Remember, I said I took the notes for you. This is where you're going to find them. So you don't have to take notes. Estrella says, can we enroll in your CNA program even if we're in New York City? The answer to that is yes and no. I know it's complex. In Florida, anybody can challenge the state exam. You don't have to go to class. You don't have to do training. You don't have to do clinicals. You don't have to do anything. You just register for the test. You take it. If you pass it, you're a CNA. Awesome. but you're probably not going to pass it if you don't have some training behind you, and that's what we're all about. Now, in New York, it's a little bit different because in New York, you have to prove training. You have to prove clinical hours. So you actually have to go to school in New York to be eligible to test. Now, schools in New York use our program. So you might be watching me in a school in New York, or they told you to watch me as part of the curriculum. But on your own, you would have to register for a CNA program licensed by New York. You might get the same content, but it has to be done through a school itself. Hope that helps. Okay. And thanks a lot for the classes. Some of us at Carrying Out Non-Medical Practices, we can manage, though am concerned about those few clinical practice which worry me since they're technical in nature. Yeah, and what we're planning on doing here is explaining all of those technical points point by point so you understand the impact of each one and how it relates to your performance. Good point, Jake. And we have lots of skills videos that list the actual testing checkpoints on the bottom to help you master those steps that are a little more technical. All right, so these are the notes. We are going to watch a video for just a few minutes. You can pretty much fall asleep in any other point in the class and be okay. This video is the one thing that you have to pay attention to, because everything that we do from this point is going to build on what we learn in this video. If you don't get this concept, the rest of it doesn't really make sense. Good? Makes sense? Good? All right. So give me just a few minutes. We're going to show you the video for this. And when we're done with the video, we're going to come back and talk about it. Now, the video is going to mention a topic called activities of daily living. And bless you. And I see a lot of students like scribbling this down because it's not in the notes on page 17 or 18. So I want you to know that I do have a lesson for this on page 89. So it is covered in your book. You don't need to go there. Just know that there are notes for activities of daily living, and it's on your syllabus. We'll talk about that in just a few minutes. Good? Okay. All right. So we're going to go ahead and show the care plan and the CNA, Jake. The care plan and the CNA, why it's always about the care plan. A presentation brought to you by foryourcna.com. Thank you for joining For Your CNA's online CNA Test Prep. We will be preparing you for both the written and skills portion of the exam. This course contains videos, interactive lessons, activities, testing care plans, test registration instructions, practice questions, and much more. This program goes way beyond our skills videos available on YouTube. But in order to pass the test, there is one single principle that you must understand: the importance of the care plan. Without this key, learning the skills is meaningless. You might be able to mimic what I do in the skills later, but chances are you will fail the test because you didn't follow the care plan. So this course will teach you the skills, but you must first learn how those skills need to be done. So come on inside and I'll explain to you how the care plan works and why it is so important to the test. We are sure that you will become great CNAs and you will provide excellent care for our residents. But before you get started, let's review some basics. Does anyone know what the initials CNA stand for?
Certified Nursing Assistant?
That's exactly right, April. A nursing assistant is there to assist the nurse. You will be receiving all of your instructions from the nurse and must follow their directions. This will probably include taking vital signs and assisting with personal care tasks. But you may also be asked to assist with other nursing procedures as well. It is important to only do the things that you have been trained to do. If you aren't sure how to do something, ask someone for help. It's okay to not know everything. But please, don't try to do something that you aren't familiar with. It might harm the patient.
In this online CNA Test Prep program, we're going to show you how to do all tested skills. But that is only the beginning of your education. You will learn way more on the job because every patient is different and will have a different way that those skills need to be done. And that's where the care plan comes in. As a CNA, you will be expected to assist our patients with many routine tasks. Generally speaking, CNAs help patients with things that they can no longer do for themselves. Things like sleeping, toileting, grooming, bathing, dressing, eating, socializing, and activities. Together, these are called the Activities of Daily Living, or ADLs. These are things that everyone does every day for a healthy life. But not all patients will be able to do these things for themselves because of illness or injury. Sometimes people are too weak to go to the bathroom on their own or feed themselves. And that's where you come in. If a patient needs help with any of these tasks, you will be there to help them. But not all patients will need help with all tasks. This is Henry. Henry had a stroke and has right-sided paralysis. And this is Martha. She had a left hip replacement. This is Bob. He has had a recent leg amputation. And Annie has dementia. And they will all require different care. Some patients will need help brushing their teeth, but others will do that themselves. As a CNA, we will help the patients do the things that they cannot do alone, but we will let them continue to do the things for themselves that they can do.
How will I know what I'm supposed to do with each patient?
I'm so glad you asked, Cassie. As the registered nurse caring for these patients, that's my job. When a patient gets admitted to our facility, I will do a head-to-toe assessment. I will review all body systems to evaluate the patient for real problems and potential problems. This is a very long, complicated process, but here's a brief overview of a general assessment. I'm going to look at his neurological status. I'm going to look at his cardiac status and his respiratory system. I will also look at his integumentary system, which is hair, skin, and nails, and his gastrointestinal system. His urinary system is important, as is his musculoskeletal system. And then I will review his endocrine, lymphatic, and reproductive systems. And finally, I will review the doctor's orders for this patient. I will use all of this information to determine the patient's real and potential problems. Here's an example to put it into perspective. Let's say that this patient has just had a right hip replacement. Now we know that she will need to continue her activities of daily living. She still has to eat, drink, go to the bathroom, bathe, groom, and dress. And after my assessment, I know that she did all of those things herself until today. However, she cannot get out of bed for any reason for the next 3 days. So, since we know that she must stay in bed, I have to figure out how to meet all of her ADL needs. The easiest way to evaluate basic needs is using the TEAMS method: toileting, eating, ADLs, mobility, and special. As the RN, I'll take all the information I gathered during the assessment to figure out the best way to help her. She can't get out of bed, so I have to figure out the best way to meet her elimination needs: bedpan or catheter. I also know she is at risk for constipation. Since she's not moving much and she's on pain medication, this is a potential problem. She can feed herself, but the trays must be brought to her in bed. She can't sit all the way up because of surgery, but she can't eat lying flat either. She has dentures, so they must be within reach at mealtimes. And they must be cleaned daily. She's able to clean herself as long as the supplies are brought to her, but she can't reach her legs or feet, so she'll need help. She is on total bed rest for 3 days. And she also needs her dressing changed every day. You can see how the RN uses all the information available to create a plan of care specifically for this patient. This is called a care plan, and it's something that only an RN can do. Of course, this was a simplified version of the care planning process. A real patient's care plan is much more extensive. Every single aspect of her health, condition, and ability level will be evaluated in order to help her. Even the smallest decision can have long-term consequences. The RN will write a detailed care plan for the entire healthcare team to follow, and the care plan must be followed exactly.
So every patient will have a different care plan?
That's correct, Ben. Every care plan will be different because every patient will be different. Even patients that seem alike because they have a similar diagnosis or have had the same surgery may have differences in care. CNAs don't have enough education or experience to know all the differences. So as a CNA, your job is to read and follow the care plan for every individual patient. In fact, you could say that your job is to follow the care plan, the whole care plan, and nothing but the care plan. Do you think you can do that? Can you follow directions exactly?
I can.
Absolutely.
Sure.
Yes.
Awesome. Then you're well on your way to being a great CNA. But helping patients with ADLs isn't all that you will do. You are also there to help the nurses by making observations. The CNAs are the hands and the feet of the patient. If the patient is cold and cannot reach their sweater, you will get it for them. If the patient can't brush their own teeth, then you will do that for them. If the patient can't get up to shower, then you will help them stay clean. You will become their hands and feet to help patients with things that they can't do themselves. But you are also the eyes and the ears of the healthcare team. You will report everything you see, hear, smell, or feel to the nurse. This is the most important task that you have as a CNA. If you see redness around a wound, you must report it. If you hear the patient wheezing after walking to the toilet, you must report it. If you feel that a patient's skin appears warmer than usual, you must report it. If you notice that a patient is coughing when eating, you must report it. As a CNA, you will be spending much more time with the patient than the nurse does. So you will be in a position to notice a lot more about the patient. The nurse needs this information to make decisions about the patient's care. Reporting these observations gives the nurse another assessment opportunity. That new assessment may even change the tasks you are assigned to perform. This is called the nursing process, and here's how it works. The RN assesses the patient and develops the care plan. This gives you specific tasks to do. While doing those tasks, you notice things. You report those observations to the RN, and the RN performs another assessment to review the changes in the patient. That new assessment prompts changes in the care plan, and this gives the CNA new tasks to do. And the cycle continues around and around as the patient gets better or worse. This is a continuous process until the patient is discharged.
I'm not sure I understand. Are you saying the care plan is going to change all the time?
Yes, it could, depending on the needs of the patient. Let me give you an example. The care plan told you to make an occupied bed in room 201. As you changed the sheets, you noticed that the skin on the patient's backside was red and irritated. You notified the nurse, who then reassessed the patient. The nurse decided that the patient needed to be repositioned every 2 hours around the clock. This was added to the care plan as another task for the CNA. Using this model, we can respond to the needs of the patient quickly as their needs change. But it also works for patients that are getting better too. You've been assisting Mr. Hopkins with transferring out of bed and into a chair after surgery. But you notice he isn't leaning on you any longer. You notify the nurse. The nurse reassesses the patient and decides that the patient can transfer on his own now. The care plan is changed, and this task is removed from the care plan since the patient is improving.
Doesn't this mean that I'm going to be bothering the nurse all the time? Won't they be annoyed?
The nurse should never be annoyed with you for reporting changes in the patient. They are legally liable for every aspect of that patient's care. Since the nurse requires that information to plan the patient's care, they expect to receive updates from you on the changes that you see. But how often you will have to report changes to the nurse will depend on the setting you are working in. Nursing home patients are pretty stable and don't really change all that often. That's pretty common for long-term care facilities, like nursing homes and ALFs and even home care. But in other settings, like hospitals, rehabilitation centers, and hospice, patients' health can change rapidly. In those settings, nurses and CNAs are going to work closely, and constant communication is required. Since CNAs must follow the care plan and are not allowed to alter it, they can't solve problems. The RN is ultimately legally responsible for the care of that patient. If you have information about the patient that you're not giving to the nurse, the patient can suffer, and the nurse is legally liable for that. Remember, you are an assistant. You are there to help, but the nurse is always in charge of the patient. So all changes, regardless of how minor they seem to you, must be reported to the RN. When the patient is stable, you will not have much to report. It may go days without talking to the RN. But if you notice something, then it must be reported, even if you don't think it matters. If you aren't reporting observations, the nurse can't rely on you anymore. And if the RN can't rely on you, then you aren't a good assistant to that nurse. You must report to the nurse everything you see, hear, smell, or feel. Be a good assistant and report all changes and observations. This is the most important job you have. So the care plan is developed by the RN, gives the team tasks, CNAs follow the care plan, and report changes. Let's recap what we learned today. Can you tell me how a CNA knows what each patient needs?
The care plan.
As a CNA, you follow the care plan, the whole care plan, and nothing but
The care plan.
anything unusual that you notice about the patient, you must report it to
The nurse.
Great job. For the exam, you will receive a care plan. What should you do?
Follow it exactly.
That's correct. If you don't follow the care plan, you will fail the exam. It's that simple. Now that you understand the care plan, I can show you how the skills will be done for the exam. But remember, you must always read and follow the care plan. That's a big part of the skills exam. Take the brief quiz below to make sure you understand. See you in the next lesson.
Okay. Any questions on the video? Any questions?
I have a bad immune system, like a bad autoimmune system. So does that mean like if the curtain's not clean, I can get sick, like from the curtain? If I like, what's the?
If you have to, when you're deciding to go into healthcare, when you're making that decision, when you're looking at your career options and you're trying to figure out where do I want to work, what do I want to be when I grow up, right? You have to look at your own physical level of abilities. So that would be something you would want to take into consideration. If you have a dysfunctioning immune system, then working in a setting that has a lot of pathogens may not be the best idea. You may want to consider something like home care, where you're going to be around fewer pathogens. Okay? All right. So to recap, as a CNA, how do we know what to do with each patient? The care plan. And we call that the easy answer. Okay? The easy answer is the care plan. So when you're going to take the state exam, they're going to give you a care plan. Now, a lot of people just set it aside. They think it's not relevant. They do what they saw on the video. But that care plan is super important. Do you guys remember playing Simon Says in elementary school? The care plan is kind of like Simon Says. Okay, we do whatever that care plan says, and we do it quickly. And if we don't follow the care plan, we're out, just like with Simon Says. So if you kind of think about it in that way, on the state exam, if you get a care plan that tells you to do range of motion on the patient's left shoulder, what are you going to do range of motion on? Why wouldn't we do the other side too? Because the care plan. Easy answer, right? The care plan said left, we're going to do left, and we're not going to pay attention to anything else but the left, because that's what the care plan told us to do. You start to see that the skills test isn't very hard if you understand this. It tells you exactly what to do. Exactly. Just follow that and you'll be okay. Now, we're going to learn some rules on how to follow it, some things that we have to know, but follow the care plan is the basis of everything we're going to build on.
If the patient does request to do the other shoulder as well, do we do it or do we skip it and say that it's not on the list?
Okay, so great question. And that comes to number 2, the care plan, the whole care plan, and nothing but the care plan. So great segue into that. So if we're working on a patient and we're doing exercises on the left shoulder and the patient says, hey, can you do the right one too while you're here? Are we allowed to do that? What do you guys think? Why? Easy answer. Care plan, right. All of our instructions are going to come through the nurse or the care plan. So as a CNA, we only have 2 doors we can use. We either follow the care plan or we tell the nurse. That's it. Those are our only 2 options. That's all that we can ever do. We follow the care plan or we tell the nurse. So we only have 2 options. Guys, are you starting to see that the written test is going to be pretty easy? So we follow the care plan or we tell the nurse. That's it. That's it. So when you start to realize that CNA work is not thinking work, we don't solve problems. We don't come up with ideas. We don't fix anything. That's not our role. It never will be our role. That is the role of the nurse. And when we start taking that role on ourselves, we're doing it with incomplete knowledge. Because you don't know near as much about that patient and their conditions as the nurse does. Make sense? So let me give you an example. We have a patient whose care plan says that she has to sit up in a chair between 7 and 9 a.m. every morning. Out of bed, upright in a chair between 7 and 9. Now at 8:15, the patient rings the call light and you come in and she says, my back hurts today. Can I just go back to bed? Can you put me back in bed so I can lay down? Would you be able to do that? Why? Easy answer. Care plan said. So your patient has said they have a backache and they want to go back to bed. Your care plan says they have to stay up until 9. So if we just say, yep, we can't put you back to bed, suffer, does that really help the patient? No. If we put them back to bed, does that follow the care plan? So what is the one option that we have that could take care of both of those things? Tell the nurse. Yeah. So we would find the nurse and say, hey, Mrs. So-and-so is supposed to stay up until 9. She's asking to go back to bed. She has a backache. And then the nurse will take it from there. Make sense? Now, it's really important that you get this concept. And I just read something last week that really illustrates this. And I'm in a ton of CNA groups on Facebook. And every so often things will get posted there, news that is in areas different from here. And one of the articles that I saw last week were about 5 CNAs in a nursing home that were criminally charged with patient neglect because they were not following the care plan and they were making decisions on their own and patients got hurt. So these CNAs were criminally charged. Criminally charged. Now, this isn't just your employer slaps you on the wrist, the nursing board takes your certificate. This is potential jail time. And it all follows down to they did not follow the care plan. They did not perform according to their scope of practice. So it's really important that we understand what we're allowed to do and what we're not allowed to do so we're not putting our patients and ourselves at risk. So I can't really simplify this anymore. We follow the care plan, the whole care plan, everything it says, and nothing but the care plan. We don't add to it. We don't take away from it. We just follow the care plan. If we can't follow the care plan, we tell the nurse. Easy. Good? So what if we go in to do a skill on a patient? Our care plan tells us to do something. We walk in the room, we tell the patient who we are, what we're there to do, and they say, nope, don't want it. Don't want it. Now, we only have two choices here. We either follow the care plan or what's our second choice? Tell the nurse. So if our patient refuses, what do we have to do? Tell the nurse. Now, we want to encourage the patient first. Right? So if I walk in the room and say, hey, Mr. Jones, it's time to take a little walk. And he says, nope, don't want to. Well, my job is to encourage him. Okay. Are you sure? Care plan says we really should. My job is to encourage him. But if he says, no, I don't want to take a walk, then we're going to go let the nurse know. Good? Good. Any questions on that? Do you see why this is so foundational? If we don't get this, everything else I show you doesn't make any sense. You'll be out there trying to make up stuff on your own.
I have a question, but what you said about the 5 your teenagers getting arrested to charge, it kind of reminded me of the movie about the in life healthcare dude who tried killing all his patients and then he got arrested for it. It's on Netflix.
Sure. There's lots and lots of healthcare providers, unfortunately, that have made very bad decisions. Very bad. Yeah, we had one up here in Citrus County, next county north. It was one of the worst sexual assault cases by a healthcare provider ever. And it happened one county north of us. So yes, that does happen. Absolutely. But that's more along the lines of being a decent human versus understanding our role. Okay. All right. So to recap here, CNAs follow the care plan. Every care plan is going to be different because it's based on the needs of that particular patient. We follow the care plan, the whole care plan, and nothing but the care plan. And while we're doing that, we want to make observations. So everything that we notice, if your brain says, the nurse should know. Everything, no matter how minor it seems to you, has to be reported to the nurse. And that's how we keep our patients safe and we notice their changes and we accommodate them. Okay, good. All right. So this is a reminder of our role in the nursing process. So the part of this that you can't see here is the RN assesses and makes the care plan. And that's their part of the role. This is our part as a CNA. We perform the tasks, we make observations, and we report those observations to the RN. But if we don't do our job, notice that the RN can't do theirs. So half of the care planning process is on us, making and reporting those observations. So this is every bit as important as helping somebody brush their teeth or performing exercises or feeding a patient. This is every bit as important. Good? Good? All right. So if you go to page 20, you'll see an activity. We're going to take 5 minutes and answer as many questions as you can in the next 5 minutes from page 20.
no, all of the above. Was it correct? Okay.
Just do, we're going to go over each one. Just do the best you can.
Well, is there physical therapy in the hospital? 'Cause I know a lot of patients need physical therapy, like to move their legs and stuff.
Physical therapy is in all settings.
All right.
When you're done, just put your pins down so I know who's still working.
Where is that in the copy?
Right in the back where the refrigerator is. Okay, we're going to go through these real quick. Let's look at number 1. You received the displayed care plan. How far will you walk this patient? What do you guys think? Why? Easy answer. Because the care plan says. How come we're not going to walk them until they get tired? That's right. We're going to follow our care plan. We're not going to do 14 trips around the nurse's station because we want to, right? We want to make sure that we're complying with that care plan. Let's look at number 2. What do we need to help this patient? Why? The care plan. Why can't we decide that we want to walk her?
No, wait, no, I think a lot of patients, like some patients, they need walkers. That's only physical therapy, so they require walkers.
Okay. What were you saying? Okay. There it is. The care plan. Care plan doesn't say a walker. What does the care plan say? Gait belt. So do we have the authority to make that change? No, and that's why that is not the right answer. Does that make sense? Are you good with that? Okay, think about the written test. The written test is going to be giving you questions like this. And 30 minutes ago, a lot of you would have chosen walker. Because in your mind, a walker's safer than a gait belt. But are we allowed to make that decision? If we think there's a safety problem, if we think the gait belt isn't good enough for this patient, what should we do with that information? Tell the nurse. Good? Got it? All right, let's look at number 3. You just received the displayed care plan. Which body part are you going to exercise? Right hip, knee, and ankle. Why? Care plan. Because the care plan says right hip, knee, and ankle. Easy. How many repetitions are we going to perform? Why? Care plan. Number 5. What is a safety concern for this patient? Why? Care plan. Is documentation required for this skill? Why? Care plan. Yeah, now let's go down to 7. You receive the displayed care plan. Which vital signs are you required to obtain? Okay, I'm hearing different answers. What does our care plan say? If the care plan says pulse, are we going to take all vital signs? What are we going to take? Pulse. Why? Care plan. You starting to see this? You getting it?
I'm a different situation. I'm like different patients need all vital signs. Like, do we have to kind of down the pause or on?
The care plan will tell you what vital signs to take. You don't get to decide. CNAs don't decide anything. So if we're told to take vital signs, we need to know what vital signs. Okay, good. We don't decide anything. But let's go down to number 8. How long do we have to count for? Why? Okay, now I'm going to tell you that this pulse is the most failed skill on the state exam. Taking a radial pulse is the most failed skill on the state exam. Now, it's one of the easiest. It's like a 3-minute skill. It's short. It's easy. It's a no-brainer. Why is it the most failed skill on the state exam? Because for the test, you are going to get a care plan. This is exactly what that care plan is going to say. That care plan is going to tell you to count that pulse for 1 full minute. But if you go onto YouTube or you ask a family member or a friend who works in healthcare, they will tell you, yeah, we don't count for 1 full minute. We don't have time for that. We use a pulse ox, which looks like a little clothespin. Put it on the finger, press a button, and we get some numbers, okay? Or they'll tell you, yeah, if we take a radial pulse, it's just 15 seconds. You multiply that by 4 to get your minute reading. We don't count for 1 full minute. You'll hear that all over the place. You'll see it on YouTube. So if you go into the test and you've watched YouTube or you talk to a family member or you work in a setting that uses a pulse ox, right? You might not choose the right answer. You may be going by what you've seen or what you heard, but that's not appropriate for this patient. What does this patient need? 1 full minute. And if we don't follow that on the state exam, we fail because it's not about taking the pulse. The skills that you are going to perform are not about the skills. They are about whether or not you know to follow the care plan. Okay? Good? Makes sense? Okay? All right. So if you know that for the test, you're going to get a care plan and you have to follow that care plan exactly. We now know this. Would you like the care plans that are going to be used on the test? Sure, that would give you a head start, right? Well, here's 4 of them. These are the actual care plans that you're going to see on the state exam. They're right there for you. But I told you we're going to learn 21 skills, and that's just 4. Do you want the rest? Turn to page 25 in your book. Now, those of you joining us at home, if you'd like access to this book, you can order it. It's in our shop just below our YouTube feed. It's also on flcnatraining.com. So these are the actual testing actual testing care plans that you would get on the state exam. So when you go take the exam, they're going to give you 3 skills to do. Now, they're already packaged in these sets. And the test uses 11 preset care plans for the test. And these are the 11. Each one of these care plans is very scientifically put together. There's nothing random about this test at all. And this is kind of surprising to students because everything has been scientifically put together. So when you look at all of these, they follow a very specific pattern. There's one skill that is an ADL skill. Remember what we learned about ADLs, right? This is everything we do for ourselves. So mouth care, denture care, dressing, bathing, that type of thing. There's one mobility skill, which means we're moving the patient in some way. So walking a patient, transferring them out of bed and into a wheelchair, turning them over in bed, doing range of motion. We're moving the patient in some way. And then one is a documentation skill. It's a skill that requires us to document something. So every single person who takes the exam will get a documentation skill. And these are how they divide up the skills to make it fair for everybody. You will get one of these. Good? Page 24 explains what I just told you. Each care plan has one ADL skill, it has one documentation skill, and it has one mobility skill that makes up that care plan. These are how they're divided up, which group each skill goes into. Now, this isn't going to really make any difference to you now, but as you go through the program and it starts to click, you may want to go back to today, and it is 10 o'clock on the first day, so you know where to, scroll to. So at 10 o'clock on the first day, we cover which skill goes into which category, if that becomes important to you later. Good? So when you go take the state exam, the computer is going to pick one of these skill sets for you to perform. The evaluator does not pick. The computer does. So, and it's actually set when you register for the test. So when you register and it creates your ID number, inside that ID number is coded which set you're going to get. Interesting. So when you go take the test, the evaluator is going to give you the care plan set that you've been assigned to perform. So can you give me a number 1 to 11? Pick a number, 10. Okay. So, oh, good. It's right here. So the computer picked skill set 10 for me to do. This is my skill set. When I go into the state exam, the evaluator is going to read this to me. They can't even trust that I know how to read. They're going to read it to me. And then once they read it to me, they're going to hand it to me. And now that is my care plan set throughout the entire test. I can go back and look at this as many times as I want to, whenever I want to. So if I get halfway through a skill and can't remember, am I supposed to do the right side or the left side? I can go back and look. Okay, good. Good. Now we have these right up here when you start practicing in class. There is no practice in the first 2 weeks. I got way too much to teach you. No practice in the first 2 weeks. But after that, in week 3 and 4, you will have a little bit of practice time after or at the end of each class. The week after class, so we have 5 weeks of learning. The week after, on Monday and Wednesday, you guys are allowed to come in here and practice everything that you've learned using the care plan sets, the supplies, the mannequin, the bed, all the things, just like it were a real test center. So you are able to sign up and practice on the Monday and Wednesday after graduation. Okay, good. So these are always available for you up here. Questions? On the back side of each care plan set are the actual checklists that the state is going to use to grade you as you're performing the skills. And we're going to get into that a little bit later, but I'll pass these around so you guys can take a look at what the care plan sets look like. But remember, you have them, you have all of these on page 25. This is just a classroom version for when you're practicing. You can purchase them as well if you have some need to have a physical copy. For you guys, everything in this class, everything that I tell you about, all the resources that we have, we discount them for you guys being in this classroom. Those that are attending virtually, they don't get the discount. They have to pay full price. What? So I think these are like $48.99 on our website, but for you guys, it'll be $35.99 while you're enrolled in the course.
The number at the top right, the skill set, what does that mean?
That is the amount of time that you're going to have to perform that set of skills.
All right.
And we're going to talk about that a little bit later. Okay? All right. Any questions so far? Am I going too fast? I know I'm having to compete with the pressure cleaner. Okay, so let's talk a little bit about our scope of practice. So our scope of practice is defined at the state level. Your scope of practice is actually defined through state statutes. So your scope of practice is, for all intents and purposes, a law. And it's important to understand that when we aren't following our scope of practice, we're actually breaking the law, which is what happened to those CNAs that were charged. So it becomes very, very important that we understand what our scope of practice actually is. Good? Make sense? All right. So in order to understand this, we have to understand that we don't know as much about those patients as we think we do. There's always information out there that we don't have. So let me give you a different example. Let's say that we have a group of patients on a nursing home floor that are diabetic. And the nurse she gives the insulin, she does all the diabetic things, but you have been trained to watch for symptoms. So things like dizziness, weakness, nausea, sleepiness, those types of things. And you're told to make sure the nurse knows if the patient has any of those symptoms. So there's one patient that is called a brittle diabetic. Brittle means that we're really not able to control their blood sugars very well. They're high, they're low, they're all in between, and it really doesn't have much to do with our food and medication management. It just does what it wants to do. Okay, so brittle is really hard to manage. So this patient, brittle diabetic, gets pale and shaky and sweaty. You go tell the nurse. The nurse mixes sugar and orange juice, takes it to the patient drinks, gets better. A couple days later, patient gets pale and sweaty, and you tell the nurse mixes the orange juice and the sugar, gives it to the patient gets better. This goes on for weeks. And one day, the nurse is not on the unit. the nurse is at lunch and the nurse that's covering is taking care of an emergency on a different unit. So it's just you and the patient. And the patient gets pale and sweaty and, kind of dizzy. And you know what the nurse normally does. So you go mix sugar in orange juice and give it to the patient. What you've seen the nurse do a million times. And the patient always gets better, but not today. You mix sugar into orange juice, you give it to the patient, and they get worse. And before long, they're unresponsive. And now they're breathing funny. And they get taken to the hospital. And we find out that they're in a diabetic coma and they eventually die. Now, who's responsible for that?
The RN.
The RN, that's correct. The RN is responsible for what happens to that patient. So you made a decision for another person that resulted in that patient's death. That's a scary place for the nurse to be. So the nurse is going to very quickly say, I did not tell that CNA to take that action. It is not on the care plan for that CNA to take that action. That nurse is not going to take responsibility for a decision you made. Does that make sense? You can only do things that are indicated on the care plan because the nurse has decided that they will accept the responsibility for somebody else doing that action. Does that make sense? What happened here, the part you didn't know about, is when you went and told the nurse, hey, this patient is dizzy and pale and weak, and the nurse went and mixed sugar and orange juice and gave it to them, there was a step there you didn't see. That patient was wearing a wearable blood glucose monitor, which gives the blood sugar on a screen in a back room. So when you told the nurse the patient was having symptoms, the nurse went and looked at the blood sugar, verified it was low, then mixed sugar and orange juice and gave it to the patient. There was a step there you did not know. And that step you did not take. And the signs of high blood sugar and low blood sugar are often the same. So you gave a low blood sugar treatment to somebody with high blood sugar, and you added more sugar into their system, and it ultimately killed them. CNAs kill a lot of patients every year. We don't talk about it. I think we should be talking about it. I think we should understand that what we do matters. And that this is the most important thing that we need to understand in order to be a CNA. Because if we violate our scope of practice, it's the patient that's likely to pay with their life. This is important. Make sense?
So, like, say it's not on the care plan, but the nurse asks you to do it.
That's fine. That's fine, as long as somebody is directing you to take that action. Yep. So let me back up. Not somebody, as long as a nurse is directing you to take that action. Okay. So ultimately, the nurse is still responsible. So what the problem comes in is when you start taking action on your own. Okay. Now, I won't say that the nurse isn't, how do I put this? Not all nurses are ethical, and I get that, and I understand where you're going with that. But for the most part, you're not going to run into that problem. Okay. If you're working with a nurse that you don't think is ethical, I would suggest a transfer. Find another place to work. Most nurses, you won't have that problem with. Questions on this? Do you guys understand why the care plan is so important? Because there's action that we don't have. There's things we don't know. And if we're making decisions based on incomplete information, it can put our patients at risk.
Like, what are the differences between like nurses and CNAs? Like, when looking in the hospital and stuff like that.
Nurses are thinkers. They're the ones that make decisions. They're the ones that have all the information. CNAs are doers. You do what you're told.
The white stinger?
Yeah. Jake, move my car, please.
Sorry, guys.
Thank you.
No problem.
Okay. So in order to understand this concept of scope of practice, the care plan is just one part of that, just one part of it. So we have to talk about the whole thing. So far, we've just talked about the care plan itself. So everything I'm going to be telling you about is starting on page 13. It's going to have to do with this little graphic here, which I put on the screen large for us here. You can see that the care plan, the whole care plan, and nothing but the care plan forms our foundation. This is what we stand on. This is the basis of everything that we do. But there's more to it than just that. This is something we call the 5 key phrases. Every question you have in this class is going to be answered with one of these 5. Every question. Go back to this and it will answer it for you. So if you have a question about what to do with the patient, what is our answer? Care plan. Absolutely. But if you have a question about how to do that skill, that becomes your walls, right? Our walls are what keep us from going into places we shouldn't be. So there's 2 principles here we have to learn. The first is CNAs do normal. Now, how do we define normal? Normal is a routine task on a stable patient that you have been trained to do in order to do by the care plan. That is how we define normal, a routine task. So if this is a task that is not routine, if let's talk about blood pressure real quick, okay? So blood pressure is usually taken on the upper arm. That's how we normally take blood pressure. If we have a patient who doesn't have arms, both of their arms are gone, they had a horrible accident, they no longer have arms, is blood pressure a routine task now? No. So would a CNA be able to do that? No, that is not normal. So if the CNA can't do it, who would have to do it? The nurse, right. So if we have a patient and we're needing to do a skill, but that skill isn't normal, then the nurse would have to do the skill. Now, as a CNA, we can be trained to do other tasks. We'll talk about that in a minute. We're going to talk about delegation in a minute. But in general, if it's not routine, it's not CNA. Got it? Okay. Now, the second part of that equation is stable patient. Stable patient. So that means as a nurse, in order for me to delegate a task to you, I have to be reasonably sure that this patient isn't going to have any surprises. That this task is just going to be performed like all other tasks and you're not going to have any surprises along the way. I have to be reasonably sure of that. That is called a stable patient. If I have a patient who is in the ICU and I tell you to go take a blood pressure, sure, you're taking it on the arm, but chances are this patient isn't going to have a normal blood pressure because they're in the ICU, right? That means that you might have to make a snap decision. And CNAs don't get to make decisions, not snap or otherwise. So our patients must be stable. Good? Good. So a lot of students ask, well, what, I can't work in an ICU then? I'm not saying that. Some ICUs will hire CNAs for routine tasks. Some. But it's pretty rare because our patient base must be stable. And most people in the ICU don't meet that criteria. Good? Make sense? Okay. Now, the third part of that equation is a skill that you have been trained to do. Pulling up a YouTube video is not training. Okay? You can't go, well, I got to clean a trach today. Let's see what YouTube says. No, that's not training. Training is a nurse taking you to a place and doing the skill in front of you. Then telling you how to do the skill, then watching you do the skill and correcting you. That's training. Now, training can be in a classroom. It can also be one-on-one at the bedside. I can take you to the bedside and say, okay, I'm going to teach you to do this skill. Now, remember, we have to go back to normal, right? Routine task. Let's go back to that patient that doesn't have arms. Now, this patient is going to get their blood pressure taken on their leg, but that's going to be routine for this patient from this point forward. As long as I don't expect any surprises, I can take you into the room and I can say, you're going to be the CNA for this patient. I want to show you how to take a blood pressure on this patient. Okay, so routine task can be routine as an industry or routine for the patient. Good, good. Stable patient, we expect no surprises. Tasks that you've been trained to do either in a classroom or at the bedside. And you've been ordered to do it on the care plan. So I've taken you in, I showed you how to do a blood pressure on this guy's leg. You now know how to do a leg blood pressure. Good. You're going to do that on this guy. But you can't decide 3 months from now that you want to do a leg blood pressure on some other guy if it's not on the care plan. Does that make sense? So you can't take skills that you've learned and apply them to a new person in a new setting just because you know the skill. It has to be on the care plan. Good? Good? Okay. Super important. Now, we bundle all of that up using one word, normal. CNAs do normal. I know I'm having to compete, guys. Can you all hear me okay? I'm trying to project. I won't be able to talk after class, but that's okay. All right, so let's go over to this side. Principles guide performance. So now we know what to do. We know what we're allowed to do. Now we got to figure out how to actually do it. And that's where our principles come in. That's all the things on the back wall. Now, these are going to tell us how to do certain skills. There are kind of our steps to put not too fine a point on it, okay? They're things that we have to know in order to be successful. These are things that are not on your care plan. So one of the things that we're going to learn is nothing goes on the floor but shoes. So this... So this might get a little complicated when it comes to changing sheets. Because most of you guys, when you change your sheets at home, when you take the old sheets off the bed, where do you throw them? On the floor. Yeah. We take them off the bed, throw them on the floor, put the new sheets on, then we bundle them up, take them to the laundry room, right? But they go on the floor. Now, one of our rules is nothing goes on the floor but shoes. So if we're used to throwing sheets on the floor, it's not going to be a far stretch for us to throw sheets on the floor. But we can't do that in a clinical setting. Okay? So we have to know this. So this is a principle. One of the linen rules is don't let clean or dirty linens touch the floor. We don't put anything on the floor. It's not going to be on our care plan. These are things that are not on the care plan. These are things we have to know in order to perform the skills on the care plan. So that's why we have to learn all of these. And that's where most of our time in class is going to be centered around, is learning all of these principles, why they're important, and what happens if we don't, bless you, adhere to them. So this is going to take up the majority of our time together in the next 4 weeks. Okay, so we're not going to focus on this right now. But that's designed to keep us safely in our scope of practice. Now, above it all, we have to remember that this is about the patient. It's not about us. It'll never be about us, ever, ever. This is about the patient. And I have a saying, help doesn't help if it doesn't help. Okay? Help isn't help if it doesn't help. Now, what does that mean? If I hire somebody to come in and clean my house, because I'm a very busy person, so I hire a house cleaning person, they come in and I tell them, I want you to clean my house. Now, I assume because they're professionals, they know what I mean when I say clean my house. Okay? So I did that about 4 years ago. Hired a house cleaner. Team of 3 people come in. I want my house clean. When they vacuumed and mopped, they did not move a rug. Did not move any rugs. When they wiped the counter, they did not move anything. When they cleaned the top of the oven, they did not get where the, my touch screen thing. They did not clean that. So they cleaned the things that they thought they wanted to clean, but they didn't do the things I wanted them to clean. I've got sliding glass doors. They cleaned just as far as they could reach. So the top 1.5 feet was still dirty. Do you think I had those people back? No. Help isn't help if it doesn't help. So my responsibility was to outline exactly what I wanted, what I expected for them to do. Good? Does that make sense? So that's going to be a part of what we learn. Things that we are expected to do that are truly meant to help. Good? Make sense? Okay. This may be a little different than the way that you normally do things. We're not working with you. We're working with another person. Good? Good. And then the last thing that we have to remember is that 2/3 of our job is observation and reporting. So we report everything we observe. If it looks funny, we tell the nurse. If it sounds funny, we tell the nurse. If it feels funny, we tell the nurse. And if it smells funny, we tell the nurse. So let me give you an example. Doesn't matter how minor this observation is in your mind. If you walked into a patient's room and you smelled grape Kool-Aid and you looked around and there's no purple cups anywhere, you probably would think, yeah, I must be going nuts. There's no reason to report that. Grape Kool-Aid, why would I report that to the nurse? Well, the smell of grape Kool-Aid is actually the very first sign of an infection called Pseudomonas. And once you smell it once, you'll pick it up when just walking into a room. But if you didn't report that to the nurse, you went in, you smelled grape Kool-Aid, but you didn't tell the nurse anything, she has no idea that that patient has an infection brewing. And Pseudomonas can get really bad really fast. So we missed an opportunity to start prompt treatment because you decided it wasn't worth reporting. You made a decision that is going to affect this patient's outcome that you didn't have any right to make. Make sense? We report everything, no matter how weird it seems to you. Medicine is weird. It's weird. You're going to see all kinds of stuff that you didn't expect to see or feel or hear. Report it all. Because there may be something in there that saves the patient's life. Good? Good? Okay, so let's talk about delegation now. Along your travels, at some point, the nurse is going to want to teach you something that you don't already know. And your question to that is going to be, am I allowed to do that? And the answer to that is going to depend entirely on three things. The first, this is we're on page 14. The first thing that it depends on is your state statutes, what the state says CNAs are allowed to do. Now, every state is different in this. Florida is pretty wide open. Florida doesn't really restrict this. The Nurse Practice Act is basically if the RN can do it and they teach you to do it and it's appropriate to delegate, then you can do it. Pretty much wide open. But other states are like, hold up, not so fast. There's a couple states that don't let CNAs take manual blood pressures. There's a couple states that don't let CNAs do anything with catheters other than empty them. So you have to know the rules of the state that you work in. And this is going to be very important if you decide to move to another state, because remember, CNA is not universal. Okay, good? Make sense? So the first thing that we have to know is, does my state let me do this? The second thing we have to know is, does my employer let me do this? Now, this is super important, and it's a part that nobody really thinks about. If we have a patient in a healthcare facility and something goes horribly wrong and that patient sues, they're not suing the CNA. You don't have anything. What are they going to take? Your Corolla? I mean, you don't have anything to take, right? So would they sue the nurse? Well, the nurse has a little bit more. She makes a little more money than you, but she doesn't have a whole lot. The person in this scenario who has the most to give is the facility. So patients sue the facility when things go bad. Make sense? Good. So the facility is the one that truly holds the liability here. Now, because they hold the liability, they are going to get to pick and choose what CNAs can and cannot do. So even though in Florida, CNAs can do pretty much anything, in our facility, we don't let CNAs do these particular tasks because we want the RNs to do it to decrease our liability. Make sense? Okay. Yay. Exciting. All right. So the first is state statutes. The second is going to be your facility policies. And then the third is, have you been trained to do it? Those are the three things that we need to know in order to delegate any task to a CNA from the RN level. If you haven't been trained, then I can train you. I can take you to the bedside and train you, as long as I know that the state allows it and the facility allows it. So when you're asked to be, if somebody says, hey, I want to teach you to do this task, and you go, hey, can I do that? The answer is the nurse has already made that determination and is looking to train you. Okay, good. These are processes the nurse has to go through in order to make this work. So learn the new tasks because it makes you a much more valuable employee. But not everybody is going to be trained on the same tasks. So let's say that you go to work in a mother baby unit. What's your name? Yep. Ariella. Ariella goes to work at a mother baby unit. And she is going to learn how to swaddle like her life depends on it. She will turn those babies into footballs. No time flat. She will be a swaddling queen. Now, we don't swaddle adults. That is restraint. So you're not going to use that if you go to work at a nursing home. Those skills don't transfer. Make sense? So the skills that you use, that you learn, are going to be based on the setting you're working in. Now, let's say that you go to work in a same-day surgery center where people go in, they have their surgery, they go home in the afternoon. They don't stay overnight. Like everybody's gone at 5. This is a 9 to 5 or actually a 5 to 5 job. You go to work at a same-day surgery center and you go to work in post-op, which is after surgery. Now, everybody in surgery generally has a catheter inserted and an IV. That's kind of like standard 101. So both of those things have to come out before this patient goes home. So you would be trained to remove catheters and remove IVs by the nurse because of the setting that you work in. Now you work same place, exactly the same place, except you work in pre-op, not post-op. So you're not going to be trained to take out catheters or IVs, not in your daily routine. You would be trained, though, getting your patients ready for surgery, maybe doing a surgical prep. So those aren't skills that you need. Those are skills that you need based on the setting that you're working in. Make sense? Good? All right. So a question that I get about this point is, well, what about liability? And the answer is CNAs don't have liability as long as you're operating under your scope of practice. Remember our scope of practice? We follow the care plan. We do normal. We follow our principles. We remember it's all about the patient, and we report everything to the nurse. As long as we do those 5 things, we have no liability. No liability. The facility and the nurse takes all of our liability for us. Now, if we step outside of that, though, nobody's going to take responsibility for you. And let me give you a good example of this. This happened in Ocala, right up the road, very close to us. This made national news earlier this year. There was a nursing student, young man who was in nursing school, and he was at the hospital doing rounds, his clinicals. And a call light went off. Patient asked to get out of bed and into a chair. And the nursing student, he was not assigned to this patient. He just went in to check on the call light, and the patient asked to get out of bed and into a chair. So the nursing student helped him out of bed and into a chair, and the patient fell, hit his head, and ultimately died. This happened about 2 years ago, but the case just got settled a couple months ago. Now, why was there a case? Because this nursing student was not assigned to that patient, did not know the care plan for that patient, did not use the correct procedures for transferring, and actively contributed to this patient's ultimate death. That person went on to take the state boards and is now working as a nurse.
With no repercussions.
There were some repercussions, but not enough to affect their nursing license. Now, if you were the patient's family, how would you feel about that? Yeah. You would start to think that maybe your patient died for nothing, right? Or your family member. So we have to understand that these rules exist not just for us, but for the good of the patients as well. Okay. Good? Good. All right, you're going to read to page 21 on your own. I'm not going to go into this too much, but I want you to understand very briefly the patient experience. Because when we go to work, and when I'm talking about, by the way, when I'm talking about pages, I'm always referring to this book, the Spiral book, not the yellow book. Okay. So when we're talking about patients, we have to remember that everybody is an individual. How many of you guys have siblings? Anybody have siblings? Are you exactly like your siblings? No, you have different personalities, you have different needs, you have different wants, you have different ways of looking at the world, right? So you know that people are different. Even two people that came from the same parents are different. So how much different are people that aren't related going to be? Okay? People are different. So we can't treat everybody exactly the same. But I do want to talk to you just in very broad general strokes a little bit about our patient's experience. Have you ever been sick? When you're sick, where do you want to be? Home, your bed, your couch, your TV, your remote, yours. That's where you're comfortable. Now, when we're caring for patients, we're generally not caring for them at home. They're in a facility, which means they're not home. Where do they want to be? Home. So they're going to be grumpy. Now, have you ever been sick? Your mood is grumpy, grouchy, irritable. Give me what I want, go away, right? So we've got somebody who's not where they want to be and they're grouchy. We're not setting up for a great patient encounter so far. Yeah, I know. If I hold up 2 fingers, I get balloons. So we know that this patient is in a very different headspace from where we are. Now, let's make this a little bit worse. Your patient is super self-absorbed at the moment. Something is wrong with them. They know something is wrong with them because they're not home, but they don't know what that's going to mean for their life. Is this going to affect their ability to work? Is this going to affect their ability to live alone or in their home? Is this going to affect their ability to afford future health care? What is their significant other doing while they're in here? Who's feeding their cat? Who's collecting their mail? They got a lot going on in their brains that you aren't a part of, which means they're probably a little distracted. So we have somebody that's grumpy, grouchy, irritable, and distracted. Do you think they're listening to everything you say? Do you think they're going to remember you the second you walk out of that door? So we can't put our mindset on our patients. They're in a different headspace. Make sense? Good. Sick patients have a right to act sick, and they often do. One of the maddest I've ever gotten at a CNA that I worked with is one that came out and said she started it, pointing to a patient. I don't care if she started it. This is her reality right now. You are being paid to be nice, period. I don't care what she is going through. It does not impact your reaction to her. If you expect your patients to be nice and kind and upbeat and happy and thankful and appreciative, you are in the wrong business. That is not our patient. If you have a nice patient, that is a great day. Be thankful. That's not the norm. And don't go into this thinking it is the norm, because you're going to be very disappointed and you're going to end up taking that out on the patient. Good? Read page 21 for more. All right. We also have to remember that every patient is different. Every patient that we care for is going to be different. So that means that all diabetic patients aren't going to be treated the same way. All hip replacement patients aren't going to be treated the same way. All patients with high blood pressure are not going to be treated the same way because they have other conditions as well. They have other levels of ability and restrictions. We have to understand that everybody is an individual. So don't make decisions for one patient based on what you saw with another. You would go by your care plan. You would have to be trained to work with that patient. Okay. All right. So we're going to go ahead and take our break now. And when you get back, we're going to get into the CNA exam. Break is going to be 15 minutes. Okay, thank you. All right, if we can have our cell phones on silent or vibrate, that would be helpful. Okay, any questions on what we've gone over so far? We know to follow the care plan. If we can't follow the care plan, tell the nurse. That's it. That's it. That is the basis of everything that we're going to learn from this point forward. So how hard can it be? They give you instructions, follow them. That's it. All right, let's talk a little bit about the test. This is going to be on page 12 of your book. We're going to talk about testing day. Our closest testing center to us is in Tampa. There's 3 testing centers in Tampa. There's one that's near the airport, which is the closest to us. There's one mid-Tampa around USF. And then there's one on the west or the east side of Tampa.
I checked into that beforehand, and they need a code to register.
No, we're going to talk, yeah. Nope. There's no code for challenging. And we're going to go through the test registration itself on next Wednesday, class 4. We'll go through I hand out the test registration forms. We go through them in class together so I can make sure you're getting the right things in the right places. But yes, you need a test code if you're testing under a school. We're not testing under a school. We're testing under Challenger. That's E3 Challenger. And if you look at the test, the training center information, it says you only fill it out if it's E1 or E2. We are testing under E3, which means that we don't fill that section out.
Okay. So it takes 6 weeks for it to usually go through. The sooner we get registered, the sooner we get the scheduled date for the test.
We're going to talk, let me go through this and it's going to answer that question. Okay. So testing day, our closest testing center is in Tampa, and you will be there with 8 strangers. Or I'm sorry, 7 strangers. 8 people test per session at a testing center. You're not going to be testing with the people in this room because everybody tests independently. So you're going to register for the test, they clear you, and then they issue you a test date. So everybody's testing independently. You won't be testing with the people in this classroom.
So it's like a standardized testing.
Or I'm going to talk about all of that. Let me go through the testing process here, and that'll clear up a lot of your questions. Okay. So when you go to the testing center, there's only 3 things you're allowed to take in with you. You can't take your phones. You can't take tablets. You can't take any electronic devices into the testing center with you. Can't take any study material into the testing center. You are allowed to take your test admission letter. If you can't print it out, no big deal. They've got it there. But you can take your test admission letter. You can take your keys, and you're going to take 2 forms of ID. One form of ID is going to have a picture. This has to be a non-expired, government-issued ID. So your driver's license, your passport, a VA card. That's it. You have to have one of those 3. Or an ID, like a Florida ID if you don't have a driver's license. Okay. The second form of ID has to have the exact same name as your photo ID. The exact same name. But it has to have a signature. So your Social Security card would work as long as the names match. A debit card would work as long as the names match. Okay. So 2 forms of ID, one with a picture, one with a signature, both match. Once you go into the testing center, you're going to be in a waiting room with 7 other strangers. There's going to be 2 rooms off of that waiting room. One of them is where we do the clinical skills. It kind of looks like this. You're going to have a bed, a clock. You'll have a bathroom area. You'll have a 3-drawer unit. You'll have a supply shelf with supplies. It's going to look a lot like this. The other room is going to be a computer room where you're going to do the written test on a computer. You don't have to have any computer skills. They're actually going to get you logged in. All you have to do is be able to move a mouse. That's it. That's all that you need to be able to do. Good? Once you're in that waiting room and they log you in, the two evaluators, because in Florida we have two evaluators, those two evaluators are going to disappear for about 20 to 30 minutes. So you're going to be sitting in a room with 7 strangers and nothing to do because no phone. Don't make friends. This is not the day to make friends. You don't want to talk about the test. You don't want to talk about what you've learned. You don't want to talk about how nervous you are. You don't want to do that. And the problem is that when you start having those conversations, this is how they go. Oh my gosh, I'm so afraid I'm going to fail. This is my second time I failed hand washing on the first try, and I'm scared to death. And somebody else is going to go, how did you fail hand washing? And they're going to say, I didn't use enough paper towels. And you're going to go, paper towels? How many paper towels? And they're going to say, well, I only used 3. And somebody else said, well, no, you got to use 10. And you're going to go, 10?
Yeah.
10 paper towels?
Just
Really?
make fun.
So you end up, what happens is you end up increasing your anxiety before you go test. You don't want to do that. Okay? Put your fingers in your ears, la, 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 la. Don't make friends. The way that we teach you is according to the actual testing checkpoints. And I put my money where my mouth is. Every step I show you, I actually show you the checklist that they're grading you on. This is the step we're going to do, and this is the checkpoint we're going to get for it. Every single skill that I do in this class will be according to the actual checklists that are being used to grade you. So what you're being shown is correct. But that doesn't mean it's the only way a skill can be done. How many of you guys clean a bathroom?
Yeah, I'm gonna help you.
Okay. Do you know that the way you clean a bathroom is probably different than the way the people sitting next to you clean a bathroom? Some of you start with a sink. Some of you start with a toilet. Some of you start with a shower while you're showering before you clean the rest of the bathroom. Everybody does things a little bit different. It doesn't mean that one way is the only right way. Does that make sense? Everybody with me? So what I'm showing you is correct according to the checklist, but that doesn't mean it's the only way these skills can be done. So the people that you're sitting in there with may have learned a different way, and it's perfectly okay for the test. No problem. It's a difference in performance, not a difference in standards. Does that make sense? Okay. So it's important that we understand that on testing day, we don't want to be comparing our notes with other people. We just want to go in, do our test, and leave. After that, teach the world. These are all skills that anybody can learn. And we desperately need CNAs. So if you have somebody in your life that you think would make a good CNA, you should be talking them into becoming a CNA. We have 1 million CNAs in the country. We are 1 million CNAs short. Well, what does that mean? If every CNA recruited another CNA, just one, we would not be short-staffed. And man, your job would get a whole lot easier. The reason CNA work is hard is because we're short-staffed, but that's not what CNAs do. They go home and complain to anybody that'll listen how horrible their job is.
Yeah.
And if that's the case, why would anybody want to sign up for that? Right? So we actively go out of our way to make sure that our job stays hard. Why? Recruit. Recruit. But recruit the right people. Okay, good. All right. So those evaluators have disappeared for 20 to 30 minutes and they finally show back up. And you wonder, what were they doing for those 20 to 30 minutes? Well, this is what they were doing. In that time, they had to divide you up into groups of 2. And this is very scientific, nothing random. They don't just point at 2 people and go, okay, you're group 1. Doesn't work like that. This is very, very what we call prescripted. So when you go to the test, you have your 3 skills that you're going to be assigned to do. And you have 3 skills that you're going to be assigned to do. but you both need patients to do those skills on. That means that the other people that are there to test are going to be patients for the people testing, and then you will become a patient for them while they're testing. Okay? So during the test, you will be both patient and CNA. But they have to pair you up. And there's some guidelines they have to use. But one of the things they're going to ask you when you come in and you get checked in is, do you have any physical conditions that would keep you from being a patient for any of the skills that you're expected to perform? So if you have a sprained ankle, you would want to let them know, hey, I've got a sprained ankle, because they're not going to use you for ambulating or transferring. You're not a patient for that. So if you've got ambulation and you've got transfer, you can't be a patient for them. Got it? Now, some skills require that we physically move a body. So turning a patient over, transferring them out of bed and into a wheelchair. Well, we want to pair you up with somebody your body size or smaller if we can. We're not looking to make this super hard. We want to make it the easiest possible testing conditions. So that means that as you get checked in, they're going to be kind of taking a look at who you are and how you're shaped and what size you are and all those things to pair you up based on the skills that each person has. And this takes 20 to 30 minutes to put together. Okay, good. So when they finally come in, they're going to take all 8 people and they're going to group them into 4 groups of 2. Now, there are a few testing centers that test 16 people a day, but that's just 2 groups of 8. So everything I'm telling you is based on a group of 8. Okay, good. So we have 4 groups of 8. Now, just for ease of demonstration here, I'm going to make you 2 over there group 1. Okay, don't go anywhere. You 2 are group 2. You've got about 45 minutes to an hour before you have to be back in this waiting room. You don't have to stay in here. Remember, you don't have a phone in here. You don't have study material. It's very boring. So you can go out to your car and you can study. That's no problem. Or you can go to Dunkin' and get a iced coffee. No problem. But you need to be back here in about 45 minutes. You guys are group 3. You've got about an hour and a half to kill. So target clearance shopping. We'll see you in a little bit. You guys are group 4. You've got about 2.5 hours before we're even going to think about taking you back to test, because we got to get through all these people first. So you can go to Chili's 2 for 1 margaritas. We'll see you in a little bit. Okay. So you 2 get brought into the testing center. Now, you've never been there. You don't know where any of the supplies are. You don't know how to work any of the equipment. So they have to give you a little orientation. So they bring you in. They show you how to work the bed. They show you what they use as a privacy curtain in this setting. They show you where the bathroom is. They show you where the supplies are. It's a little mini orientation. And then they pick one of you to go first. And I'll just pick on you because you're close. And they look at your Prometric ID and they find what skill set you have. And they get the right skill set and they read it to you and hand it to you. And that is yours throughout your entire test. So put it in a place that you can see it very quickly and easily. And you will become the patient for her. Now, when you're the patient, you're actually going to get a script. And that script is going to tell you to be pleasant, cooperative, and you. Not a 90-year-old version of you. Okay? So if you have to walk, you're going to walk like you walk. You're not going to stoop over and pretend like you can't walk. If somebody's going to feed you, you're not going to drool all over, right? You're going to be you. You're not trying to win an Academy Award here. And you're going to be pleasant and cooperative. There's a couple skills where they're going to give you other very specific targeted instructions. Listen to what they say. Okay, good, good. All right, so you will do your 3 skills on her. She will be your patient. While you're doing your skills, you are going to be checked off on a checklist. We're going to get to that in a minute. When you're all done, you get your own skill set, different skill set usually. Doesn't have to be, but usually. You will do your skill set on her. When you are both done, you will go out to the waiting room and group 2 will be brought in and we will repeat the process through all 4 groups. Once all 4 groups have tested for the skills, Then everybody goes into the computer room at the same time. They sit down, they do their test on the computer. And at the end of that, when you are all done and the test gets submitted, it gets graded immediately. Your results get printed out, they're folded over, and they're handed to you as you exit the facility. You are not allowed to look at those results while you're in the testing center. You have to be outside because they don't want you to argue with them. And they will. People do. Both. And I'm going to show you what they look like in just a minute. Everybody got a good overview of testing day. Florida's really lucky. We actually get our results same day. Most other states, they make you go home and wait. Hours, days before you don't eat. I mean, you're just sitting there chewing on your nails, waiting for those results to come in. I mean, Florida really does have it together, and I'm very thankful for that. Okay, so good. So I'm going to show you what this looks like now that we have a brief overview. We go into the testing center. We're shown around. Tester 1 gets their care plan, and it's read to them. They get physical custody of it, and tester 2 becomes the patient for those skills to be performed. Any questions? When they're grading you, it is not random. They don't get to make judgment calls. It is a list. They have to go by this list. They don't get to alter this list. If it's not on the list, it's not graded by the evaluators. Because remember, there's a million ways to clean a bathroom. Okay? There's a million ways to do a skill. And they may all be correct, but we want to grade on what we call minimum competency standards. That's what this is. Minimum. You're not showing that you're the best CNA in the entire world. You're not. You're showing that you know just enough to keep from killing patients. That is what you are showing. Okay? All right, so let's talk about skills grading. This is going to be on page 65. All right, so when you are performing the skills, the evaluators have a checklist. It's the same checklist that you see here, same checklist. And when you do a step correctly, you get a check mark. If you don't do the step, no check mark. If you do a step but it's wrong, no check mark. The only way to get a check mark is if you do that step correctly. Anything without a check mark is called a deficiency. Now, the evaluators do not fail you. The evaluators do not pass you. Let me go back here. The evaluators have no say at all in your score, other than checking a box that says you did that step. That is it. That is their entire influence on your test. And I hear it a lot online. That evaluator failed me. That evaluator failed me. No, the evaluator did not fail you. The evaluator put a check mark in a box. That's all they did. The evaluator has to take your deficiencies, anything without a check mark, and put it into the computer. And the computer is the one that decides whether you pass or fail. Now, why is that? Because these steps are not graded equally. Let me give you an example. Let's say that we have to brush this lady's teeth. Is she in a safe position? What do you guys think? If I were to brush her teeth right now, what would happen? She's going to choke. Technical term for that is aspirate. Okay? So she is not in a safe position. So that's a pretty important step, putting her in a sitting position. Pretty important for safety. Now, have you guys brushed your teeth this month? Anybody? Yeah, you somewhat familiar with this concept, right? Okay, so when you brush your teeth, you don't brush your teeth like this. You brush your teeth like this. Because all of that foam, you want to go in the sink, not on you. So when we brush our teeth, we're usually leaning forward a little bit. Make sense with me? When we put the head of the bed up, our patient is not leaning forward. They're sitting more like this, back a little bit, which means that all of that foamy mess is going to end up on their clothes. So what might we be able to put on their chest to help maybe prevent their clothes from getting all messed up?
I can put the head up and the pillow and then put like a little protective thing.
Right. We would want to put a towel or some sort of a protective thing on their chest. Good? Make sense? Okay. Has anybody died from getting toothpaste on their clothes? No. So putting something to cover their clothing is important, but is it as important as putting the head of the bed up? So every step is going to be weighted based on the impact to the patient if that step isn't done. Does that make sense? So I know somebody in here is going to go, but wait, how many steps can I miss and still pass? Depends. Which step did you miss? Because if you miss the one that we put the head of the bed up, yeah, that one step is going to fail you. Why? Because you killed your patient. Make sense? Good. If you kill your patient on testing day, then you probably don't need to be a CNA. So the answer to that is, how many can I miss? Well, if I'm the patient, please don't miss any. And that's what I'm doing here, guys. You don't realize this, but I'm getting older. And I know in my not too distant future, I'm going to need healthcare. And I've seen the healthcare that's out there. And my job is to create a healthcare workforce that can take care of me. And that's what you're training for. You are training to be able to take care of me someday. So I want you to do the steps correctly. So if you're talking about me and you're asking how many steps can I miss, the answer is none. If you're the patient, how many steps do you want them to miss? None. Everybody has that standard. The test is not about you. The test will never be about you. Who is the test about? The patient. So that's what all of these checklists are centered on, is the patient. And once you get that concept, once you understand this, the test actually becomes pretty easy. Good? Good? All right. All right, so after that, we go take a written test. Now, I'm going to talk to you a lot more about the written test as we go through the program in later sessions, okay? But I want you to understand that when it comes to the written test, CNAs don't think. We follow directions, but we do need to know how to communicate with patients. We do need to know the proper procedures to take. We do need to know safety. We do need to know to follow the care plan. And we do need to know a few things about what we call theory, right? Things like things that we should know in order to do our jobs correctly. So this framework is called the FACTS, the CNA FACTS, F-A-C-T-S. And it tells us exactly how to answer the written test questions. We follow the care plan, that's our F. We apply the skill, which are all the steps we need to know to do a skill safely, all the things on the back wall, all those principles. We communicate effectively, and I actually have a really cool way of teaching you communication. It's called Read the Room.
Okay.
R-E-A-D, read the room. We understand theory. That's where your yellow book is going to come in. I'll talk to you about that in a little bit. And safety is super important. But above all, above everything else, we have CNA. Now, CNA stands for Certified Nursing Assistant. We all know that. But what it really means is changes need assessment. When we see something in our patient, If there's a change, then we have to report that to the nurse so they can assess that change. So our role as a CNA is to recognize a change and get a nurse to assess it. So changes need assessment. So if you see a question that indicates there's a change in the patient, your answer is going to be notify the nurse. Now, once you understand that framework, the written test, super easy. And I have a whole workbook that you can download for that. I'll tell you a little bit about that as we go through the program. But if you want a little bit of extra help for that written test, this framework will help you with that. I do charge for that. It's normally $24.99, but I'll give you a discount code to bring it down to $14.99. It's a good investment if you're concerned about the written test. Okay. But in the meantime, along the way, I'm going to teach you those principles in class. You just want that workbook, that guidebook, that framework, if you want to be able to practice those principles as I teach it. Okay.
So, in this book, I'm gonna say that we can't call patients like sweetie and dear.
Right.
And like,
We haven't got to that. I'll cover. Trust me, I cover everything in the class.
I'm a huge TV show binger, and like non-American TV shows, like love to doctors, people.
Yeah, just because you see something on TV doesn't mean we should do it.
So like if a piece of kids.
Yeah, Superman flies doesn't mean I should try.
No, I okay. Yeah, I
Okay.
know.
I read online that one of the most common reasons for failing the written part is failing to mention the call button. Is that true?
No.
No.
Mm-mm. No, actually, the most common types of questions that are missed on the state exam fall into three categories. The first is safety. The second is communication. And the third is about understanding the importance of the care plan. And those are, the questions we did on page 20 a little while ago, right? Where you had the care plan and I asked you questions about it. If I had given you that before you saw the video, you would have gotten most of those wrong. So those are the types of questions that you would see on the care or the exam. So those are the three areas that most people fall short. Okay. Yeah, but the call light, very, very, you may have one question on the call light. It's not that common. Okay. All right. It's important to understand too, when it comes to the state exam, all of you guys are not getting the same test.
What?
Yeah. When you go take the state exam, it's on the computer. Every one of you is getting served a different set of questions out of a huge question pool. So if you have somebody that you talk to that had a test and they said, oh my gosh, there were 6 questions on the call light, that doesn't mean that your test is going to have even one because it's being pulled from a pool of questions. I'm going to teach you a framework doesn't matter what the question is, you're going to know how to answer it. All right, I have a free ebook on the written test that you can download. If you go to foryourcna.com/ebook, this is free. Anybody can download this, and it kind of goes over some categories and some general testing tips on the written test. By the time I'm done with you, that written test is not going to be a big deal at all. Skills is really where you want to put your time and attention. Now, I have another resource for you when it comes to the written test. I do a live game show on YouTube twice a month on the first and third Wednesday or Tuesday of every month. So next Tuesday, not tomorrow, but next Tuesday will be my next game show. And this is just go to my YouTube channel. It's For Your CNA on YouTube. And you can compete for prizes. We give away t-shirts and badge holders and all kinds of good stuff. And you're answering questions as I'm giving them to you. And when you answer them, the program I use sits on top of YouTube and they read your answers when it comes in and puts points to your answers and puts you on a leaderboard. And this is a great way to be able to practice all of the types of questions that you would see on the state exam. I've been doing this for 3 years. So if you go back and watch my playlist, there's well over 1,000 questions in there that you have access to. Okay. This is what it looks like on the screen. You have the question, you have the answer choices, and I explain the rationales after each question. First and third Tuesday of every month. So the next one will be next Tuesday, a week from tomorrow. And on the bottom of your syllabus, down here, the very last QR code, that takes you to the playlist.
Also, if you sign up for the SMS marketing, I send out a text message
Yes.
notifying everybody 15 minutes beforehand.
Yep. All right, so let's talk about our results. So somebody asked about this a minute ago. Jake?
Yes, ma'am.
Do you know where my results? Yeah.
I know we had pulled it out to speak with Ms. Brown. I don't recall what you did with it after that.
We had passed it around
Oh, here we
too.
go. The eliminated piece?
Yeah.
Here we go.
Thank you. Okay. So this is your admission to test letter. This is a sample. This is what it looks like. So when you're cleared for testing and they give you your testing day, this is what you're going to get in email. You can print it out with you and take it to the testing center. If you can't print it, no big deal. They've got it there. It's okay. But once you're done with the test, you're going to get your results. Now, this is the result for the skills. This is what it looks like. It looks just like the results, whoops, for the written. They look very, very similar. At the very top, this is the written. At the very top, you're going to see candidate has passed the written test. So it tells you whether you passed or failed. They're not going to give you a numerical score. It's not going to say 82%. It'll just say passed or it'll say failed. Now down here on the written test, we have our 5 categories of questions. How many questions was in each category and how many you got right from that category. Again, I get this question a lot. How many questions can I miss and still pass? And the answer is, it depends. What did you miss? If you selected an answer that you put your patient in mortal jeopardy, we probably don't want you as a CNA. You're not quite there yet. One question can fail you. You guys get that? Because it's not about the number you get right or the number you get wrong. It's the type of answers you're picking. Do you understand your role or do you not? That's really what it's all about. Okay? So when we look at this, you're going to see total number of questions per category and how many we got right per category. Now, the ebook that I showed you just a minute ago, where is it? This ebook will help you understand these categories. Good? Questions? Okay. Now we have our results for our clinical skills. So up here again, it says candidate has passed the clinical skills exam. And down here, it's going to start to list the skills that you actually were asked to perform. The first one will always be hand washing because everybody is going to get graded on hand washing. Now, hand washing is not on our skills list. Remember this list that they gave you? I told you they're going to make you do 3 skills. Hand washing is not on there. Hand washing is one of what we call our hidden skills. So we have 3 visible skills that we are going to be performing, but while we're performing these 3 skills, they're going to grade us on 2 additional. One of those is hand washing. So we're going to wash our hands at the beginning and the end of the skills, and they're going to grade those. We also are going to be graded on indirect care. Now, indirect care is kind of how we treat the patient while we're doing the skills. So we want to make sure that we're respectful, that we're listening to them, that we're looking at them to make sure they're safe, that our focus is on the patient. We'll talk a little bit more about indirect care in a little bit. So we're being graded on the 3 skills we know that we're supposed to do on our care plan: indirect care and hand washing. You're going to get a grade on all of them, and you must pass all of them to be successful. Now, you're also going to get this page. That's this one here. This is a deficiencies page. Do you guys remember we talked about this? Anything without a check mark is called a deficiency. So when the evaluators put these deficiencies into the computer, this is what you see. In Florida, we have 2 RN evaluators. So if a deficiency shows up twice, it counted against you. If it only shows up once, it did not count against you. That means that one of the evaluators saw you do it. The other one was scrolling on her phone or something. It did not count against you. Good? Good. This is what the computer is going to use to determine whether you're safe to go out and practice as a CNA. Questions? I'll pass this around so you can actually see the all of the forms that you'll be given. So another question I get is, what if I make a mistake? And the answer is, it's not the end of the world. Let's talk about worst case scenario. What if you fail? Well, you would have to retake the portion of the test that you failed. So let's say that you passed the written but failed the skills. Well, you have to wait 30 days and then you can retake just the skills portion. The written that you passed stays for 2 years. Okay. Or if you failed the written but passed the skills, then you would go back and retake the written test. This passing grade would stay for 2 years. My students do fantastic. You're not going to have a problem on either end. But if you do, because nerves, just remember you only have to retake the portion that you failed and you have to wait 30 days between attempts. Good? Good. But let's get a little more granular. What if I'm in the middle of the test and I realize I made a mistake? I didn't close the privacy curtain before I did a skill. And I'm at the end of the skill now, and I realize, oh my gosh, I forgot that step. What do I do? Well, we can actually make corrections. I have a whole lesson on this, page 33. We can make corrections. So I would tell the evaluators, correction, I would have closed the curtain before I started the skill. Now, can we turn our phones on silent, please? So now I go from not getting that check mark to getting a check mark. And the paper doesn't know whether I did it or I corrected it. It's still a check mark. Okay. Good? Make sense? So this is how we make corrections. And you can make corrections anytime during the skill. I recommend that you make your correction as soon as you realize that you've made a mistake. But when you get to the end of the skill, all the way to the end, we have to tell the evaluators that we're done with that skill before we can move on to the next. Now, the reason we're telling them I'm done with this skill is because that locks in our ability to make corrections. Once we say my skill is done, I'm finished, task is complete, whatever we say, we are no longer able to make corrections past that point on that skill. So what I instruct my students to do is when you get all done doing your skill, go back and read that care plan. Read it again. Make sure that you did all of the steps on that care plan. And then if you need to make a correction, make it before you say my skill is done. Make sense? Good? Okay. So reread that care plan before you say my skill is done. Most of the time, they're going to tell you, I need to see it. I need you to actually perform that step. But there's some things that they're going to say, okay, no problem, and they'll just give you the check mark. For instance, if you didn't open or close the curtain before you did the skill, you can't open it at the end. So you would say, I would have closed it before I started the skill. They don't really need to see that. They can check that off. But if you said, yeah, I would have washed her back. Yeah, they need to see that. Good? Make sense? They'll tell you when they need to see something and you can demonstrate it. All right, so now let's talk about how we're going to get through the course. You have your syllabus, which looks like this. This is our roadmap, how we're going to get from here to there. And we have the 2 books. We also have an online course I'll be telling you about in just a few minutes. Let's talk about this book. This book is strictly for homework. You're going to take this home and you're going to read it. On Mondays, between Monday and Wednesday, you're going to read one chapter. Between Wednesday and Monday, longer period of time, we're going to read 2 chapters. So tonight, you're going to go home and read chapter 1. Wednesday, you're going to read chapters 2 and 3. And yeah, they're long. Wednesday, this first weekend is the worst homework weekend you have. Okay, I'll be very upfront with you. But we don't work out of this book. And when you find a discrepancy between what I tell you and this book, always go by what I tell you. Because my instruction is based specifically on Florida's exam. Good? Good? So this we're only going to use for homework. But let me show you, I don't like this book. I do not like this book. It's good for students. The words are small. The writing is big. There's lots of pictures. It's written at a 6th grade level. It's easy to get through. But the problem with this is it doesn't truly reflect the role of the CNA in a way that I think is effective. And let me show you why. In the back of your book, turn to the index and look up care plan. Jake, do we have an extra book over there? I keep meaning to get the page number. So this is going to be on page 271. In the middle column, about a quarter of the way down. Now, what do we know about the care plan, real quick? What do we know? Yeah, and it forms the basis of everything we do, right? So we would expect this care plan to be on every single page of this book. It should be that important, right? If you look in the index, how many pages in this book talk about the care plan? Pages 7 to 8. And guys, it's a paragraph. It's a paragraph that ends and goes to page 8. Care plans are mentioned once in this book. Once. I don't like this book. I don't think it effectively encapsulates the role of the CNA properly. But it does have important background information that you need. And that's why you're going to go home and read it. But understand that it is not the total source of information that you need. Got it? Good? All right. So when you go home and read chapter 1 tonight, you're going to read it in this book, the yellow book. But we want to take a test to see, did we get the information we needed out of that yellow book? So we're going to go to page 181 in our white book, our spiral book, and this is going to be a test based on this. Now, I don't expect you to remember all this when you get home. So let's look at our syllabus. Let's go back to our syllabus. If you're looking at this syllabus, the rows across are each day of class. So you can see this section right here is today. The next section is going to be Wednesday. The following one is the next Monday and Wednesday. So each class is listed in sections going left to right. But there's also columns at the top going down. So the very first column are the skills that we're going to learn in class. So for us today, we learned skill rules. We've got that. Remember, we followed the care plan, the whole care plan, and nothing but the care plan. We make observations and report those to the nurse. So we've got that. We still have to learn the opening and the closing. We have to learn hand washing and indirect care. And I've only got an hour and 20 minutes to get through all of that. The second row, or column, I'm sorry. The second column are things that we're going to talk about in class. These are my lectures. Now, we've already covered this. We covered what to expect on the CNA exam. We covered delegation and liability. We covered that every patient is different. We covered the testing care plans. And we covered the principles and how we're going to use those to learn our skills. So we've already covered all of that. The third column is your homework. This is what you're going to go home and do. And you can see there, you're going to read chapter 1 in your yellow textbook. You'll see below it, you're going to take the test in the white book on page 181. Good? Good? You'll see for Wednesday, you're going to go home and read chapters 2 and 3 in the yellow book and take the test on page 182 and 183. Any questions so far? This last column, this is my wish list. These are the things that I hope that I'm going to get to, but we may or may not, depending on the questions that come in and how late I run and those types of things. So some of these you may have to read on your own at home. Today, we covered the 5 key phrases. Remember, that's that little house thing? So we've got that one done. We covered the care plan activity on page 20. We learned about corrections. We learned about skills grading. And I'm hoping that I'll get to warm, dark, and moist, but I may not. So when you go home tonight, if you didn't hear me talk about warm, dark, and moist, you probably want to read about it. Okay? Spiral book. Spiral book. So are we good? So there's a lot of information on this one page, but this is how we're going to get through both books in 4 weeks. You need to do your reading in the textbook before you take that test. Yeah, don't take the test on your own, and then the answers are going to be in chapter 1. I need you to read chapter 1. Okay? All right. You're welcome. Okay, so once you've taken the test on page 181, you're going to turn to page 201, and that's where your answer key is going to be. You're going to check your answers in the back of the book to make sure that you got them right. If you didn't get them right, go back to your reading and figure out why you got it wrong, because you're missing some information. Okay. Good? Questions? Okay, let's go to our spiral book. Now I'm going to teach you how we're going to use this book to learn the skills that we have to perform on the state exam. Every skill that we're going to learn has a page that looks like this. This is the one for pulse. I'm going to use it as a illustration, but every skill is going to start out with a page that looks very much like this. Down the side here, you have the principles that are involved in that particular skill. We're going to get to principles a little bit later, but know that the principles for that skill are here. They're going to be spelled out here. So skill rules, we know to follow the care plan. We're not just going to follow the care plan, it's the whole care plan and nothing but the care plan. And anything we observe, we report to the nurse. That's skill rules. We already know that. That applies to every single skill. So that's going to apply to the pulse. Good? We have to learn the opening a little bit later today. We're going to learn about glove rules on Wednesday. We're going to learn about the pulse itself on Wednesday. And we're going to learn the closing later today. We're going to put all of those things together and make a skill out of it. Okay? We have a video on this. And then down here, oh, I'm sorry, all of the principles that we're going to learn are detailed. Everything on the back wall is detailed on page 27 for you as well. Let me explain to you how these principles work. When I was creating this program, and I've been doing this for over 20 years now, When I created this program, I realized that every single skill, didn't matter what the skill was, every single checklist, whether it's catheter care, feeding, range of motion, didn't matter what the skill was, every skill, number one, was exactly the same on the checklist. Every single skill started out with the same number one. It also had the same number two. So I thought, wow, if I just taught the students to do these two things, they would get 2 check marks, didn't matter what the skill was. Make sense? So then I started looking a little bit further down the checklist, and I noticed that at the end of each checklist, there was some more things that were exactly the same. And I thought, wow, I can do something with this. So we created the opening. These are steps that have to be done at the beginning of every single skill that we do. And they're designed to get these check marks on every checklist.
I actually can't read the small print. What are the first 2 steps?
Oh, okay. The first one is greet the resident by name, introduce self. Greet the resident, address by name, and introduce self. We're going to get into this in the opening in just a minute. The second one is provide explanations to resident about care before, beginning, and during care. But you don't need to know that. You need to know the opening itself, which we're going to get to in a few minutes. Okay. So I did this for every single skill. I looked at all 20 skills, because hand washing is a little bit different, all 20 skills, and I tried to figure out what are the things that these skills have in common with other skills. And that's how these principles were born. So the principles that we're going to learn are proprietary to me and my teaching method, but you're going to see them pretty much everywhere. A lot of facilities have now adopted these principles as part of their operating procedures. So even though we're very small here, we're having a national impact, not just on training, but also on direct care performance in facilities. So you have to become familiar with these because it's going to dictate how you work your practice. Diane says, I've been seeing so many people posting that they passed their CNA exam, and today it's finally my turn. I'm so happy to say that I passed. Congratulations, Diane. Great job. We're super proud. Okay. So we have all of these principles spelled out here. So we have the short version here. We have them spelled out here. They're teeny tiny, hard to see, but we're going to go through them all one at a time as we go through the program. Then down here, we have a skills video. Well, I'm sorry, our short version. This is what we use when we've done the skill a couple times. We just need to remember the big steps. We have a video for the skill. And then down here, we have test-specific information. So when you go take the test, there's a couple of things that you need to know about how the test is going to be set up for you to be able to practice as if it were the test. The first thing that you need to know is how much time do I have to do this skill on the test? And that's what this first little icon is. So if you look at the bottom of page 52, you'll see a little clock there, and it'll tell you 5 minutes. You see that right here? Okay. Every skill is going to have a different amount of time because every skill takes, shorter or longer to do. So you would want to look at this and be able to perform, when you're practicing, be able to perform the skill within that time period to know that you're going to be okay on the state exam. Now, this test, this skill, Pulse, remember our care plan on page 20, it said we were going to count for 1 full minute and record our readings. They're giving us 5 minutes to do that. 5 minutes. You're going to count for 1 minute, but they're giving you 5 minutes to do it. Okay, so understand that these times are based on somebody with your level of experience, which is none. They overinflate the time. So don't worry too much about running out of time. You're probably not going to run out of time on the state exam. We're going to talk about that a little bit later in the program, about time management when it comes to testing, but understand that you have the amount of time on this page to be able to refer to. The next section, let's see here. Well, let me go back to that. All right. So you actually pointed this out, Christian, right? Okay, you actually pointed this out earlier at the very beginning of the program when you said these little circles. And I told you that was the amount of time that you got to do the skill. Okay, so pulse, remember they gave us 5 minutes. That's what we just saw on this page, right? They gave us 5 minutes. But if you look here, look at the very center. Okay, measure and record pulse. It doesn't say 5 minutes next to it. Up here, it gives you a total time of 34 minutes. On the test, your skills aren't going to be timed per skill. They are timed per test. And they actually give you way more time than you need. So if you go to page 71, I'm going to show you how this works. On the bottom of this, remember we passed this around a little while ago? On the bottom is the formula that we use to determine skills timing for the entire skill set. When they're determining timing, they give you 3 minutes for hand washing right off the bat. Doesn't count against your skill time at all. They give you a full 3 minutes for hand washing, not associated with skills. They also give you 5 minutes for what we call transition or thinking time. So it's an extra 5-minute bonus, 5 extra minutes. And then they add up the amount of time for each skill listed based on the times, based on the times here. So altogether, that skill set would give you 34 minutes to do. That doesn't mean you need to take 34 minutes. You can get it done in 20. That's fine. No penalty for being too fast. But what happens if you're too slow? Well, at 5-minute warning, they're going to give you a 5-minute warning. They're going to say, hey, you've only got 5 minutes left. So you want to get as many steps in during that last 5 minutes as you can possibly get in. It's not an automatic fail if you go over time. They'll stop you. They'll say, okay, time's up. Stop what you're doing. So whatever didn't get a check mark just counts as a deficiency. So that's the time to turn up the speed, go into sonic mode, right? Get all those check marks in that you can. Good? Questions? All right, the next little icon down here is going to determine whether your skill is going to be done on a live patient or a mannequin. Most skills are done on a live patient, but not all. There are a few skills that are just a little too personal to be doing on another testing student. Things like dressing, bathing, hairy care. So there's a few skills that we're going to substitute a mannequin. And that's why you want to take advantage of the practice time that you have in this classroom after graduation, because we have a mannequin here. We have all the supplies here. If you're practicing at home, it's kind of hard to do mannequin skills at home without a mannequin. Okay. Now, the next icon will indicate whether the patient, whether it's a live patient or a mannequin, is going to start out in a bed or a chair. Now, you want to look at this when you're practicing the skills to make sure you're setting it up for practice, just like you're going to be testing. So if you're testing on a live person, you should be practicing on a live person. If you're testing and the patient starts out in a chair, you should be practicing with your patient starting out in a chair. That's why I give you this information. Good? And then the very last one indicates whether charting is required. So if charting is required, if we have to document something, there's 4 documentation skills: pulse, respirations, feeding a patient, and emptying the drainage bag. You will get one of those 4. You will. Everybody gets one of those 4. Pulse, respirations, feeding, or drainage bag. Everybody gets one of those 4. And that means you would have to document. Now, if you look in your book, remember these are documentation skills. If you look in your book on page 168 and 169, you will see the documentation forms that the state exam uses. I always, in the skills, I always put a small image of it right here so you can see a little reference image. But the full images are on pages 168 and 169. Good? Okay. So that's our overview page. Man, that was a big overview. Now let's get into specifics. Let's go to page 53 and learn how this page is going to teach us how to do the skills. So up at the top of the plan, we have our care plan. What do we know about the care plan? We follow it. So this care plan says patient will be lying in bed for skill, take the patient's radial pulse measured at the wrist for 1 full minute, record our reading. So we're going to take the radial pulse at the wrist for 1 full minute and record it. We're going to follow that like our life depends on it. Good? But right now you don't know how. So we got to teach you. So down below that are step-by-step instructions. Step-by-step instructions tells you exactly how to do this skill. Now, these instructions meet this checklist, but it's not written the same way because that checklist is written for an RN. You are not an RN, but I am. So I took that checklist, filtered it through an RN brain, and spit it out in CNA-friendly terms. Good? Good. So if you go home, without taking another minute of this class, if you go home and you hand this book to a live person you've got laying around your house, find a live one, dead ones will help you. You hand this book to them and you say, read step 1. They read it and you do it. You say, read step 2. They read it and you do it. You say, read step 3. They read it and you do it. You will get a perfect score on the state exam. Perfect. Now, let me show you just how detailed I can be. How many of you guys have ever made a peanut butter and jelly sandwich? How many steps are involved in a PB&J?
5.
5, okay. Any other guesses? Everybody happy with 5? You're detail oriented. There's 42.
42.
There are 42 steps in making a peanut butter and jelly sandwich. Now, we're not going to do anything crazy like toasting the bread or cutting the crust.
Fortunately, the live feed is down at the moment.
All right, well, I'll just keep going.
I think we may have lost internet service.
It's hard to tell with this. I'm just going to keep going. Okay, so it's, okay.
I'm not sure what's going on here.
All right, so peanut butter and jelly is easy for you. Your brain kind of condenses it down into 4 or 5 steps. It's pretty easy for you. But it actually isn't as easy as you think. There's a lot of steps to it. And let me take you through it really quick, really quick. In order to make a peanut butter and jelly sandwich, what do you need? Bread. Okay, let's stop there. Stop there. That bread is in a wrapper. That wrapper is contained with a twist tie. You have to untwist the twist tie, open the bread wrapper, and get 2 pieces out. Then you got to do the whole spinny thing and put the twist tie back on. Now you're holding 2 pieces of bread. What do you want to do with them? Where are you going to put them? You need a plate. You don't have one of those. You got to open the cabinet, get a plate, put it on the counter, put your bread on the plate, close the cabinet. I'll bump my head. Now we need peanut butter. That's in a cabinet or a pantry. Open the cabinet or pantry, get the peanut butter out, close cabinet or pantry, put the peanut butter on the counter. Now you need jelly. Go to the refrigerator, get the jelly out, close the refrigerator, put the jelly on the counter. Now you have to unscrew the lids. But are you going to put that peanut butter and jelly on the sandwich with your fingers? What do you need? Yeah, you need a utensil. So open the drawer, get your knife or your spoon, whatever you're going to use, close the drawer. Now you're going to take that knife, put it into the peanut butter and spread it on the bread. You'll wipe it off on the other slice of bread and get your jelly. And you'll put the jelly on the bread. Now you put the knife in the sink. Then you have to put the lid back on the peanut butter and screw it down. You got to put the lid back on the jelly and screw it down. You got to open up the cabinet, put the peanut butter back in the cabinet, close the cabinet. Got to open the fridge, put the jelly back in the fridge. You got to close the fridge. Now you can put two pieces together and eat. Did you realize it was that many steps? Now we've got a lot of information to cover. So unfortunately, I'm going to have to stop you. All right. Did you realize it was that many steps? Most people don't stop and think about all those steps. You think bread, peanut butter, jelly, sandwich. You condense it down in your mind to something more manageable, right? But there really are that many steps. Well, if I can do that with a peanut butter and jelly sandwich, just imagine what I can do with a pulse. So when you go home and you look at these steps, understand that I did not leave anything out. Nothing. I will tell you exactly when to take the cap off of the toothpaste. There is nothing left to chance here. And that's what makes this extremely powerful as a learning tool. When you were in school and your instructor told you go home and practice something, that did you no good because you had no idea if you were practicing right. Am I doing this correctly? Or am I making bad habits? Practice does not help if you don't know the right steps. And that's why I created this. Good? Good. When you're in here practicing, you should be practicing in groups of 3. One person is the patient. They're learning. They're learning what it's like to have this skill performed. One person is doing the skill. That's the CNA. But there should be a third person in the mix with the book open, looking at the steps. That way, if the CNA gets stuck, you can tell them what the next step is and they're not doing things out of order. Good. So you should be practicing in groups of 3. If you're on a mannequin skill, mannequin and 2 is fine. But you do need somebody that can make sure that the steps are being done correctly. Now, why don't I do that for you? Because if you rely on me, you're going to be in trouble on the state exam. If I am your only source of truth, you will always look to me for the answer. And that doesn't help you. It doesn't help you on the test, and it's not going to help you in a clinical setting because I'm not going to shadow every one of you. You have to know where to go for the information. That's why I'm teaching you to rely on a source that you can always have with you. Does that make sense? Good. I'm setting you up for future success. All right. At the bottom of the page, you're going to have supplies. Every skill is going to have this on the bottom of the page. It'll have the supplies, the name of them, and a little image of them. But you can also see this on page 37 in your book. I have all of the supplies listed. And the thing about healthcare is everything has 2 names. I don't know why. I have no idea why, but everything has 2 names. So if I say something and you're like, if I say bath blanket and you're like, what's a bath blanket? You can go to page 37 and it'll tell you it's also a privacy blanket. Same thing. Gate belt, transfer belt, same thing. Okay. Oh, no, it's a blanket. All right. Every single skill that I'm going to show you also has some review questions built in. If you can answer these questions, then that means that you got the important parts of the skill and your performance will probably reflect that. Good? Good? Okay, all of you have been enrolled in our online CNA Test Prep program. So if you go on your syllabus, the very first QR code there, that very first code will send you to the site where you enrolled in this course. Okay, so that's where our live stream is. That's where you enroll. That's the page you're familiar with. That's also the very first lesson in the online course. So if you go up to at the top where it says Access Course, it'll show you all of the lessons that you have unlocked. There's over 100 there. There's well over 1,000 questions. And it's completely interactive. So it's not boring. You actually get to be involved in the learning. And all of you have been enrolled in this. You have access to it right now. Okay. So what if I told you that if you just did one thing at the beginning of every skill, you would get about 1/4 of your checkpoints checked off? Just do one thing and you get a whole bunch of check marks. Would you want to do that? Yeah. That's what the opening is. We're going to do one thing and we're going to get, in this case, about half of our checkpoints checked off. So we're going to learn the opening. The opening is a series of steps we're going to do at the beginning of every skill that is going to net us multiple checkpoints. So if you go to page 30, you'll see an overview of the opening. You'll see it applies to every single skill. We have a video on it that I'm not going to show you in class. And page 31 is going to give you your notes on this. Your opening sounds like this. Nope, nope. Shh. Good morning, Miss Jones. My name is Patty. I'm your CNA today, and I'm here to whatever. Is that okay? I'm going to close my curtain, wash my hands, get my supplies, and I'll be right back. Now, just by saying that, less than 10 seconds, I now got about 8 check marks. So let me go through it again. Good morning, Miss Jones. My name is Patty. I'm your CNA today, and I'm here to insert name of skill here. Is that okay? I'm going to close the curtain, wash my hands, get my supplies, and I'll be right back. That's it. And we got 7 or 8 check marks. Awesome. Easy. But let's go through them one at a time so I can explain to you why each step is important. So the first thing that we do is we read the care plan, always. Care plan is always step 1, always. Because if we don't know what we're doing, we can't tell the patient what we're doing. So care plan, always step 1. Then we're going to knock. Now, every skill starts with the opening, and every opening starts with a knock. This is way more important than you think it is. Way more important than you think it is. So let me explain this. Let's talk about a patient real quick. Where does that patient want to be? Home. Okay, so that's problem number 1. They are not home. Problem number 2 is they are not in a private space. Right? The door is always open. They got a roommate they didn't get to pick, and the only thing between them is a thin curtain, right? So there's no privacy really. So when you are sick, the one thing that you need more than anything else is rest. That's what you need to heal. Anybody ever been a patient at a hospital? It's like the worst place in the world. It's easier to sleep in like a bus station than it is at the hospital. Okay? About every, on average, 20 to 30 minutes, some strangers coming in your room. Around the clock. Like 3 a.m. There is somebody waking you up. It's horrible. Now, okay, I don't know why that got fireworks, but all right. So we have a patient who's not at home who desperately wants to be there. We have an insecure environment, and we have frequent interruptions. Do you think this person's going to be able to sleep well? No. Okay. So now I want you to picture that. We've got a patient who is sleep deprived, and that makes people grumpy. So we've got this patient in bed, sleep deprived, finally closes their eyes, starts to drift off, and they hear a noise. Their eyes pop open, and they look up, and there's a complete stranger standing over them with a sharp object. How comfortable are they? Not comfortable at all. This is what a knock is designed to prevent. CNAs don't hurt patients. We are the only people in healthcare that do not hurt patients. We're it. Everybody else hurts patients. EKG people, they pull off those sticky tabs. That hurts. Phlebotomists, they stick you 1,000,000 times. That hurts. Nurses, oh man, they do all kinds of things. IVs and all. Surgeons come in and put tubes where tubes do not belong. X-ray people come in and put you on hard surfaces in impossible positions. And the billing people, they hurt you the worst. There isn't a single person that doesn't hurt that patient other than the CNAs. But do you think the CNAs know that? Or I'm sorry, the patients know that? They assume that anybody in pajamas is going to hurt them. So when you go into a room unannounced and that patient opens their eyes and sees a stranger, that will automatically put them into defensive mode. So do you understand why knocking is important? When we knock, we give them an advance warning. We make their space safe and sacred. We don't intrude on a space without prior warning. This is how we help our patients feel more secure in a space that they don't control. If you miss this, it is a big deficiency because it's all about the emotional well-being of the patient. I have a lot of students online, in my YouTube channel. Guys, we're the #1 YouTube channel. I've got 180,000 subscribers. I've got 70 million views. And I've got comments I can't possibly respond to. But honestly, we get about 150 comments a day. And one of the comments I get quite a bit is, I don't understand why they failed me for not knocking. Nobody knocks in a clinical setting. Okay, just because they don't doesn't mean they shouldn't. Our job is not to train you on what everybody else is doing out there, because that's not working. Our job is to train you on what you should be doing and hoping that we make enough impact on you that when you get out there, you actually do what you should be doing because you understand the importance of it. Does that make sense? Okay, so we're going to start with a knock. Then once we knock, it's a graded checkpoint. We're going to greet our resident. So this is something like good morning, good afternoon, hi, hello, how are you? We're going to be nice. I don't care if they're not. You are nice. So hello, hi, good morning. I like to ask my patient, I don't know why it keeps doing that. I like to ask my patient, how are you doing? How are you feeling? How are things going? Because if I've got something planned for this patient and their day has taken a left turn somewhere, I need to know that before we go any further. Like, I'm not going to get all the way through my opening and wash my hands and get started and say, hey, do you want to go, for a walk? And they're like, no, I don't feel good. Well, I've just wasted all that time. So I like to find out, like, up front, how are you today? How are you doing? Turn up the charm, people. Turn up the charm. You can get a lot further with patients by being charming than being mean. If you come in and you're mean to me, I'm going to resist you 100%. Be nice. So we're going to greet our patient. Once you greet the patient, it's a graded checkpoint. Then you're going to identify them by name. We don't check name bands for the test. There are no name bands. There's no wristbands on the test. Nothing like that. We are going to identify our patient by name. And for the test, everybody is Mr. or Mrs. Jones. One name. Easy. Just Mr. and Mrs. Jones. Now, the reason that we do this is because ID bands are not always accurate. Not always accurate. Just because some person in registration, a minimum wage employee, put a little bracelet on you does not mean that that bracelet is correct. They are picking a line out of a big list of lines, and they may have misclicked. This actually happened to my granddaughter. When she was about 4, her mother, my daughter, and I took her to the ER. And I didn't look at the ID band. We took her to the ER. They put the ID band on her foot. And we went back into the back and we were talking. And it was probably a half hour later. A nurse comes in, hangs an IV. And a little while later, scans the thing on her foot. A little while later, we're talking. And then the doctor comes in, looks at the ID band, and calls my daughter's name. And I said, I looked at the ID band. I said, that's the wrong ID band. That's the ID band for her. And she's not a patient right now. They pulled the wrong person. So if they had been calculating medication dosages for my daughter's size and giving them to my granddaughter, would that be a problem? Do not rely on ID bands. The best form of identification is the person themselves. What is your name? Good. Now, somebody in here is going to say, but what about dementia patients? What if they can't tell us their name? What about children? What if they can't tell us their name? Well, the second best way is to look at the care plan. The care plan will tell you how to identify that patient. Okay, we've already got the instruction manual. But our first line of defense here is to ask the patient, what is your name? Or to call the patient's name. Hi, Mrs. Jones. Anybody ever go to a doctor's office or a walk-in clinic? They don't give you ID bands. They put you in a room. They put a chart outside. The people come in and they call you by name. Hi, Jennifer. Is your name Jennifer? Okay. Courtney? Okay, everybody say hi, Courtney. Hi, Courtney. If I walked in the room and said, hi, Jennifer, how are you today? What are you going to tell me? Yeah, I don't want what you got for Jennifer. Bad enough I got to be here for Courtney. I don't want Jennifer's stuff too, right? We will correct people that call us the wrong name, especially in a medical setting. That's what we're doing here. So you either ask their name or you call them by name, either way. But their name has to be a part of the opening, not an ID band. And that is a graded checkpoint. Now, one thing that we don't want to do is call them by an endearment. Honey, sweetie, dear, love. We don't use those. We do not use endearments. It is name, 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 name. There's a lot of reasons we don't use endearments. Number one, it can give somebody the wrong idea really quick. Number two, it diminishes the professionalism of what you're there for. You are a professional. This is the only industry, people, the only industry where you can go to school for 4 weeks and get initials behind your name.
Yeah.
That means there is a level of professionalism that is required from you when you have initials behind your name. Does that make sense? So we have to make sure that we are performing professionally. And to do that, we're going to use name, not honey, sweetie, dear, or any other endearments.
What are the initials for CNA?
CNA. That's it. That's it. That's it. And there are no other initials. And I know what you're asking. I know that the heart of your question. There are no other initials for CNA. CNA is a state-mediated certification. So the state has set those standards. You take the test, we give you these initials, CNA. Now, the only place that you have to have your CNA to work, now this is interesting because everybody gets this wrong. In order to work in a nursing home, you must be certified, CNA. In order to work in home care, you must be certified or have your home health aide. So CNA or home health aide, either one, but you have to have something to work in home care because we don't have nurses in the home. We're releasing you into the wild. We want you to have something, okay? So nursing homes and home care. No other setting is legally required to hire CNAs. Now, you will have CNAs in a hospital. And if they're certified, they can use CNA. But most of the time, we're going to call them something else like PCT or PCA. If you work in mental health and you're certified as a CNA, you can use the term CNA. But if you're not certified, or to keep everybody consistent, we're probably going to use a term like mental health tech. If you're working in rehab and you're certified, you can use the initials CNA, but we're probably going to call you something else to keep everything consistent, and we'll probably use nurse tech. Now, all of those things are dependent on the setting, not the certification. Does that help you?
Yes, it does.
Okay.
How about an assisted living?
Assisted living are usually called resident aides. You do not have to have your CNA. They can hire anybody off the street and train them. Once you get your CNA, you can use it, CNA, but for consistency, they usually just refer to everybody as the resident aide. They don't make a distinction, but they usually will give you a little bit of a pay bump. Yeah. Make sense? Good? I call that alphabet soup. Okay, lots of different initials out there, but remember there's only two where you actually have to be certified legally in order to work: nursing homes and home care. Everywhere else, they can hire you as whatever and call you what they want to call you. Okay? All right, now you have to tell them who you are. And it's not just enough to walk in and say, "Hey, I'm Patty." So, Patty who? Patty, the one that brings the cookies? I like that, Patty. Patty, the one that brings the needle? Not so much, right? So, what are you? Not just who are you, but what are you? What role are you going to play in their life? So, you want to say, "Hi, I'm Patty, your CNA today." Of course, use your name, not mine. Okay. Your CNA today. So, name and title. That is a graded checkpoint. Then you're going to tell them what you're there to do. And you can read this right off the care plan, because on the test, you're probably going to be a little nervous. And you're probably not even going to have two brain cells that are rubbing together at the moment. Okay. So you get in there and you remember what I said. Every skill starts with an opening. Every opening starts with a knock. So now you know exactly where to start every skill. If you remember that one statement, every skill starts with an opening, every opening starts with a knock. And you'll hear me say that 50 times. Every skill starts with an opening, every opening starts with a knock. And you start there. If you practice the way I'm about to tell you to practice, you should be able to roll right into your opening without even thinking about it. You don't need those brain cells to rub together. You're on autopilot at the moment. Okay. So we get to that point. "Hi, Miss Jones. My name is Patty. I'm your CNA today. And I'm here to measure and record contents of urinary drainage bag." Perfectly okay. You can also make it more human. "I'm here to empty your drainage bag." Either way is fine. Put it in your words, read it off the care plan, but the patient needs to know what you're there for. Because in order for them to give consent, they have to know what we're doing. Okay, and consent is our next step. So we need to describe the skill. It is a graded checkpoint. I told you everything that I show you is going to come back to this checklist. You guys remember me saying that? That I'm going to show you every step that we do and how it relates to the checklist. This is for every skill that we're going to learn. And then we need permission. If you touch a patient without their permission, it is battery. I don't care what setting you're in. I don't care what is going on with that patient. If you touch somebody without their permission, it is battery. Battery. That is an essential concept for you to understand. We have to get permission, because help isn't help if it doesn't help. You are not there to take over. You are not there to force a patient to do anything. You are not there to override somebody's free will. You are there to help. And it's important that you get that concept. Because a lot of people go into healthcare and they get on a power trip. And they start to take over their patients and treat patients like children. These are adults. If I started treating you guys like children, you would get up and walk out. You're adults. You expect to be treated like adults. At what point are you willing to give that up? At what point? 62? 38? 27? At what point are you willing to give up your rights? Your patients aren't either. You have to get permission. Okay? This is non-negotiable. And if I can't get anything else through to you in this class, this is the one thing I want you to take out of here. This is non-negotiable. Your patient has the right to determine what happens with their body. I don't care what initials you have behind your name. Those of you who go on to be nurses, doctors, nurse practitioners, or anything else, don't ever forget this lesson. Because the minute the healthcare team starts overriding patients, that's when patients lose trust in the healthcare team. And that's when our jobs go away. This is important. Okay? Good? That's a hot button issue for me. It is also a graded checkpoint. Then once we get permission, we're going to close the privacy curtain. Now, this curtain, this privacy curtain, doesn't do a whole lot, right? There's another body on the other side of that curtain. Doesn't do a whole lot, but it does give a measure of privacy. And we want to give them as much as we can. So we do pull the curtain for every skill but one. And I'll talk to you about that as we go through the program. So this is important. It's important to provide privacy. But we have to talk about when we want to provide privacy. So let's talk about this curtain real quick. Okay? This curtain, who touches it? Everybody. Everybody. Right? Nurses touch it. CNAs touch it. Patients touch it. Family members touch it. X-ray techs touch it. Phlebotomists touch it. Doctors touch it. Everybody touches it. Can we consider this thing clean? No. It's absolutely probably the dirtiest thing in the room because these things are only taken down and laundered once a year on average. Yeah, we spray it. I mean, housekeeping does a good job. They spray it with disinfectant spray, but that isn't going to get 100%, right? So we have to understand these are not clean. So if you're the body in the bed, if you're the patient, do you want me to touch you? Think about you being in the patient if I've just touched this curtain. What do you want me to do after I touch this curtain? Wash your hands. Make sense? Everybody good with that? We're going to talk about gloves in detail on Wednesday. In detail. This is a graded checkpoint. Understand, guys, that I have been doing this class for 20 years. The slides that you see on this screen, I have put together in a very specific order. So we're building on principles. As we go through this program in the 4 weeks that you're here, we go through over 1,500 slides. And I created every one of them. Every graphic that you see on this, I created. Every character I created. I do all the graphic arts here. So I did this in a very specific way to maximize your learning potential. No. The only place you see the slides are on the live stream replays. Yeah, you'll get exactly. In fact, you'll hear me say this. Hi, what's your name? Hi, Callie. So that way you know it's this class. Okay, so remember that this curtain is not clean. It's got a ton of pathogens on it. So after we close the privacy curtain, we want to wash our hands. Now, once we have clean hands, we can go get our clean supplies. Don't get your supplies beforehand. Your hands aren't clean. You're going to touch those supplies that you're going to use on the patient with unclean hands? Don't do that. So we do our opening, we close the curtain, we wash our hands, and then we get our supplies. So our opening sounds like this. Hi, Miss Jones. My name is Patty. I'm your CNA today, and I'm here to whatever. Is that okay? I'm going to close your curtain, wash my hands, get my supplies. And we now just got 8 check marks. Easy. Now, the best place for you to practice this at home is in your bathroom. You have a door to knock on. You've got a person to talk to, the one in the mirror. You've got a curtain that you can pull, your shower curtain, and you've got a sink right there to wash your hands. So every time you go to the bathroom for the next week, every time you walk in that room for the next week, you should be doing your opening. Put an index card on your mirror, write on it with a marker, whatever you need to do. But every time you walk into that bathroom, you should see it and it should remind you to do your opening. If you do that, by next week, you will have this down and now you can go on autopilot for the exam. Okay? Good? Good? All right, I told you guys that you were all enrolled. I got to get going here. Okay. I told you guys that you're all enrolled in the online course. You guys remember that? Okay. Open that for a minute. Okay, I told you you're all enrolled in the online course. This is an activity. I'm going to show you how interactive this online course is. This is an activity for the opening. Okay, so the opening is a puzzle piece, a principle that we just learned. So we learned skill rules today, and we learned the opening today. We still have to do the closing. I still got to get there. But this is a lesson. So I've got a whole video on it. You can watch the video that walks you through everything I just talked to you about, but in a little animated lesson. And then below this, if you scroll down a little bit, you're going to see an activity. And this is what our activity looks like. It is a drag and drop activity where we're going to put the steps of the opening in order to make sure that we got it right. So you'll see something that looks like this. We can drag these cards into a different spot. In order to drag the cards, though, please remember that you have to drag at the writing, not the picture. If you try to grab the picture and move it, it won't stick where you're trying to put it. You got to drag at the writing. Good? So let's try it together. Let's see if we can do the steps of the opening together, okay? So this is a little bit of a trick question. Please remember what I said at the very, very, very beginning of this. What is our first step? There it is. Good job. Good job. We are going to read the care plan. So I'm going to drag that up to that position. Now, what's our next step? Knock. So we're going to drag that into that second position. What comes after that? We want to identify our patient by name. Yep. I always think of that. I can't sing, guys. I can't sing. Shh, 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 shh. I can't sing to save my life, but I always think about that song, Say My Name, Say My Name. Right? Okay, so we're going to identify our patient by name. Once we know who they are, then they need to know who we are. That's right. Once the introductions are out of the way and we're on a good footing, what do they need to know? Yeah, what we're there to do. Absolutely. Why are we here? What's next? Close the curtain, okay, and then wash hands and get supplies. Okay, so we got everything in the order we think it's supposed to be in. Now we're going to come down here and click on this check button. And when I click on the check button, if I got them right, I should get a gold star. If I didn't get them right, it's going to give me a red box around the ones that are in the wrong place. So I can see pretty quick, okay, those are wrong. And then there's going to be a retry button there. When I hit retry, it scrambles all of them. We got to start from scratch. This is what's called forced comprehension, because you're doing the same task over and over and over again and making sure it sticks. Okay, but we did great. We got our gold star. All right, any questions on the opening? So one more time, just because I'm nothing if not thorough. Good morning, Miss Jones. My name is Patty. I'm your CNA today. How are you? I'm here to whatever. Is that okay? I'm going to close the curtain, wash my hands, get my supplies, and I'll be right back. Good? Good. Less than 10 seconds, 8 checkpoints. We like that. Okay, so if we can do that for the opening and get all of those check marks, maybe we can do the same for the end of the skill. And we're going to call that the closing. So one thing, one event, and it's going to get us a whole bunch of check marks. Now, the amount of check marks the closing gives us is going to be a little bit different. It varies based on the skill. But we're going to go through all of the steps and we're going to do them all every time. We make it uniform. Good? Good? All right. So our closing is going to be on page 34. Shows you the steps of the closing and all of the skills it's involved in, which is all of them. And our details are on page 35. Now, our closing sounds something like this. Remember with the opening, the order mattered. We had to do the things in a specific order. Closing's a little different. The order we don't care about. We just don't care. Just get them all done. We just don't really care about the order, except for the last two. The last two steps are cemented in. Those have to be done in that order. The rest of them, don't care. Do them however you want. But your closing is going to sound something like this. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Here's your call light. Your environment's clean. The bed's in the low position. You're covered. I'm going to open the curtain. Those steps, does not matter what order you do them in. And then I'm going to go wash my hands. Now, if I have to document, remember everybody gets a documentation skill? Right? Everybody gets one documentation skill. If I have to document, I document after I've washed my hands because this pen goes in my pocket. It also goes home with me at the end of the day. I don't want patient pathogens on this pen. Make sense? So we have to have clean hands in order to document. But then we have a check mark that says we end skill with clean hands. So if we document, we have to wash our hands again at the end. So documentation skills require 3 hand washings, one at the beginning before we do the skill, one at the end of the closing, and then one after documentation. Good? Good? Okay. So let's go through them one at a time. We want to make sure our patient is clean and safe, that they're comfortable, and the test needs to hear that word, comfortable. We want to make sure that they're covered. I should never see knobby knees. I want you to think about the patient for a second. Your patient is not fully dressed. They are not dressed for company. They are in a thin hospital gown and probably not much else. They are also laying down, which is an extremely vulnerable position. Anybody ever get in a fight with somebody when you're laying down? What do if you're getting ready to fight? You get up. You stand up. You don't stay laying down. Laying down is a vulnerable position. You don't stay laying down. If you feel threatened, you get up. So we understand that laying down is vulnerable. Does that make sense? So we got a patient that's not fully dressed and they're laying down. Do you think they feel safe? They're also in a strange place. They don't want to be here. They want to be home. They're surrounded by strange people. They don't know you. Right? This is not secure. Now, take their sheet away. That sheet doesn't give a whole lot of protection, but it does give some. You uncover that patient and they're now laying there in a thin hospital gown and nothing else. How vulnerable do they feel?
Scared.
Very scared, very vulnerable. So we have to make sure our patient is covered at the end of every skill. Clothing or sheet, I don't care, but I should never, ever see their knobby knees. Knobby knees means vulnerable. Good? Make sense? Okay. We're going to open the curtain. We're going to give them their call light. And once we get all of those things done, we can go clean our hands. Once we've cleaned our hands, then we will chart, if necessary, documentation, and then clean our hands again. So let's look at each one of these individually. A good rule of thumb is to always leave your patient looking better than you found them. I love that rule. Always leave a patient looking better than you found them. Straighten the sheets. Clean their environment. Plump their pillow. Leave your patient looking better than you found them. If you adopt this as a principle, you will automatically be seen as a great CNA. Doesn't matter what your skill level is. If you do this, you will be seen as a great CNA. This is a graded checkpoint. We want to make sure the bed is in the lowest position. This is a safety issue. We're going to talk about a little bit later in the program in week 2, and this is a graded checkpoint. We want to ask if they're comfortable. Remember, the test needs to hear the word comfortable, and this is a graded checkpoint. We're going to ask if they want anything else. Remember, this patient is laying there in a strange place, surrounded by strange people and nothing to do. They're bored. You know what they're going to do for entertainment when they're bored with nothing else to do? They're going to hit that call light and see how long it takes you to come running. Over and over and over again. You want the patient off the call light? Give them something to do. Can I get you anything? TV remote, crossword puzzle book, a magazine, please, for all that's holy, let me give you something, right? Good, makes sense? So we're going to address preferences. That's a graded checkpoint. We're going to make sure they're covered, no knobby knees. That is a graded checkpoint. We're going to open the curtain. Now, I want to talk about this real quick. So when we do our opening, we close our curtain for privacy. This gives us a nice private area. For the test, your curtain is not going to go all the way around the bed. It's only going to go out about 4 feet like this. And that's because you're being tested. They need to see what you're doing in here. This is for demonstration only. Okay. I don't know why I keep doing that. I know. So that so we close the curtain for privacy during the test. And then at the end of the skill, we're going to open that curtain up at the end. Now, a question I get asked a lot is, well, can I leave that curtain closed for the patient? What if they request it closed? And if they request it closed, if they say, don't open, leave the, I don't want to see that roommate. Leave that curtain. That's an observation. What do we do with observations? Tell the nurse. That's right. This is something that needs to be reported because maybe our patient is feeling insecure. Maybe they were assaulted. Maybe our patient is depressed. That's a possibility. Maybe our patient really doesn't like their roommate. And that's something I need to know, believe it or not. Why? Why would I need to know that this roommate doesn't get along with that roommate? Why would I need to know that? Well, late last year, we had one roommate that took a leg rest off of a wheelchair. She was 93, I believe. And she beat her roommate to death with it. She was 89. To death. How the staff did not hear this, I do not know. But if we had 2 roommates and aren't getting along, do you think that's something I might need to know?
Yeah.
It's an observation, no matter how minor. Are you starting to get that? No matter how much, you do not get to decide whether something is reported. Our rule is open the curtain. If something prevents us from opening the curtain, who needs to know about it? You don't get to decide, yeah, it's not a big deal. She probably needs to take a nap. You don't decide what gets reported. Make sense? Isn't that horrible? That is just horrible. Horrible. I still don't understand why no staff members heard it. Moving on. That is a graded checkpoint. We're going to give them their call light. Now, call lights need to go in or near their hand, within reach. My default is put it in their hand. Put the call light in their hand. At the end of every skill, just put it in their hand. If you want to just leave it next to their hand, that's fine, but put it in their hand. Okay. That is a graded checkpoint. Oh, and by the way, let's talk about this real quick, because you brought it up on the written test. There is a problem with CNAs now. No, kind of always, but more now than normal. A lot of CNAs are hiding call lights. They're putting them under the mattress. They're dropping them behind the bed. They just hide the call lights because they don't want the patients to use them. Let me explain something to you about call lights. Where should this patient be in a perfect world? Home. In their home. Why are they not in their home? Okay, they're not well. They're sick. They need help, right? They need help that they can't get in their home, which means there's a reasonable expectation that they're going to need help, right? So how do they summon help when they need it? A call light. And a CNA has taken that ability away from them on their own with no direction. They made this decision on their own. Well, if the patient didn't need the call light, they wouldn't be here. The whole reason that they are in a facility is not the doctors. It's not the nurses. It's not the medicine. It's not the surgery. It's not the treatment. It is the call light. That call light is the one thing that they do not have at home, the ability to summon help. And when you take it away from them, that is patient neglect. And you should be charged criminally. Do you understand how important this is? So that should help you understand the importance on the written test about the call light. It doesn't show up often, but it is important. All right. And then once we get all of those things done, we'll wash our hands. Now, if that's a graded checkpoint, if we have to, I got to go. If we have to document, we would document after hand washing, and then that's a graded checkpoint. And then we would wash our hands again. And that is a graded checkpoint. Our cardinal rule here is to end the skill with clean hands. That's our number one rule. End skill with clean hands. Now, why would that be important? Let's talk about this patient. She is in a hospital. Okay. Anybody ever been a patient in a hospital? It is hard to be a patient in a hospital. You go to the ER and you wait for hours and you get put in a cubicle and you wait some more. And the ER doc's whole job, the whole reason that they're hired is to send you home. That is their whole reason for being there, is to prove that you are not sick enough to be here. They get you stable, they get you some medicine, and they send you home, tell you to follow up with your primary. That is their job. So the people that make it past that ER doctor and upstairs into a bed, those are really sick people. Like really sick people. Like, I need a vacation. I can't call up my local hospital and say, hey, I'd like to reserve a room for 3. Doesn't work like that. I got to prove that I'm sick enough to be there, which means that we take the sickest people in our community, the very sickest, and we put them all under one roof. All of them. That means that this is a very pathogen-rich environment. Are we good with that? You understand that? Yeah. Okay, so this patient is not wandering about, not playing gin rummy with the people down the hall, okay? They pretty much stay where we put them because they're sick. But me, I wander from room to room. I do stuff with this patient. And because I'm a healthcare worker, I do stuff with this patient that most people would not normally be doing. I'm all up in their business, right? Now, this patient has pathogens that were bad enough that allowed them to be here. Bad pathogen, big, bad pathogens. And I'm working with this patient. Now, if I take those big, bad pathogens to their neighbor also has big, bad pathogens, probably totally different big, bad pathogens that are bad enough to get them in this setting. That means their immune system, pretty busy right now. So if I take this guy's big, bad pathogens over to this guy, his immune system, probably not going to be able to fix it. You guys see how that might be a problem for our patients? End skill with clean hands is for that guy over there. We keep this patient's cooties with them. We don't let those cooties travel. Good? Make sense? End skill with clean hands. Now, at the beginning of when I go over here and work with this guy, the beginning of that skill, I can't touch that skill until I've washed my hands. So there's 2 hand washings in between this guy and that guy because medicine doesn't know what I'm going to touch in between. Good?
So start with a hand wash before documentation, and hand wash at the end of skill.
Right. Right.
Perfect.
Yep, absolutely. All right. Any questions on that so far? Are we good? Okay. So our closing sounds like this. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? I thank my patients. They are the reason I get a paycheck. I thank them. Do not be a mean CNA. That does not get you anywhere. Be nice. Thank you, Mrs. Jones. Is there anything else I can get you while I'm here? I like to take care of all my patients' needs now, because if I don't, in 5 minutes, they're going to hit the call light. There's something that they needed that they were afraid to ask me for when I was in there because they didn't want to hold me up. So now they're going to interrupt me when I'm with somebody else. So if I'm there, I'm going to try to take care of as much of their needs as I can. Do you need to go to the bathroom before I go? Do you need to drink a water? Magazine? Are you cold? You want a blanket? I'm going to take care of as many things as I can get off of my list so that when I leave this room, they're settled. They feel cared for and cared about. They're less likely to hit that call light, which gives me more time with the next patient. So don't rush this. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Okay, bed's in low position, environment's clean, you're covered. Here's your call light. You put this in your hand. There we go. All right, and everything looks good. Okay, I'm just gonna go open your curtain and wash my hands. Open curtain, wash my hands, document if I need to, and wash them again. That's my closing. I'm going to do that at the end of every skill. Doesn't matter what the skill is. Always the same way. Good? Questions? Whew. All right. So if we looked at this checklist, this is Pulse. If we looked at this checklist, just by doing the opening, knock, knock, knock. Hi, Ms. Jones. My name is Patty. I'm your CNA today, and I'm here to take your pulse. Is that okay? I'm going to close your curtain, wash my hands, get my supplies, do the pulse, and then thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Bed's in a low position, environment's clean, you're covered. Here's your call light, open curtain, wash my hands, document, wash my hands again. That's all that's left. Out of this whole checklist, I've only got those little things that are actually related to the actual pulse. I've gotten over half of my checklist checked off, and I didn't even start the pulse yet. So when you're practicing, don't skip the opening. Don't skip the closing. The opening and the closing are part of the skill. That's what's going to give you the most check marks. Good? Make sense? All right. So since you wash your hands before and after every skill, let's learn how to wash them properly. Page 44 is going to go over our principle for this. This is our checklist for hand washing here. Our step-by-step instructions are on page 45. Just to let you know, guys, I'm probably going to keep you about 2 minutes long, okay? 2 minutes over. I'm going to try real hard to get, but I've got to show you this video, and we still have to hand out I got to go over your homework. We have to hand out the review sheet. So just bear with me. It's probably only going to be about 2 minutes. So we've got step-by-step instructions on page 45. Warm, dark, and moist. This is the ideal breeding environment for pathogens. Pathogens are all the bad guys. Bacteria, viruses, fungi, all the bad guys. They usually prefer warm, dark, and moist environments. Bathrooms are the ideal warm, dark, moist environment. We are trained to turn the light off when we leave the bathroom. Dark. Bathrooms are usually 2 to 3 degrees warmer than other environments. We don't have AC vents putting air directly into the bathroom. They're always restricted because we don't like to be chilled when we get out of the shower. And moisture is already there. So bathrooms have a lot of pathogens in them. What we want to try to prevent is spreading moisture in that area unnecessarily. And that's going to impact how we end hand washing. So I'll show you that in a minute. Here's our checklist. Here's our steps. So to wash our hands, we're going to turn the faucet on, and you can turn the faucet on with bare hands, not a problem. That faucet is dirty, 100% dirty, but so are your hands, and you're about to wash them. That's okay. So turn the faucet on. Get the water comfortable. It doesn't matter what it is. It's not ever going to be hot enough to kill germs. That would be boiling water. You cannot wash your hands in boiling water. Just get it comfortable. Wet your hands. You must wet your hands before you apply soap. Soap will not lather if it's put on dry hands. It has to have that moisture underneath the soap to lather effectively. Wet your hands first. This is actually a graded checkpoint. We're going to apply a lot of soap because you're graded on bubbles. I know, but it is a graded checkpoint. You're going to scrub for at least 20 seconds. 20 seconds of scrubbing. And when we scrub, we are going to keep our hands lower than our elbows throughout the procedure. We want to scrub the tops of the wrists, the backs of the hands, in between the fingers, in between the thumb and index finger, the palm of our hands and our lacing, the bottom of our hands by our pinky, all of these areas, and it should take us at least 20 seconds. After that, we can move on to our nails. We're going to run our thumb down each one of our nails to clean the cuticles. And we're going to circle our nails on the palm of our hand to clean under them. And then we're going to rinse. So all of these surfaces around the wrists, the backs of the hands in between the fingers, the palms of the hands in between the fingers, in between your thumb and index finger, and by your pinky. All of those areas have to be hit because they're the ones that are missed the most often. We're going to scrub for at least 20 seconds using a clock that is above the sink, not a song, because you're going to be nervous during testing. What do you think is going to happen to singing speed when you're nervous? Speeds up. That is not an effective use of time. So we're going to use a clock. There's a clock right above the sink. That's what you're going to use. Keep your hands lower than your elbows. You don't want all of that back. Yeah, you just don't want them running up. Okay, good. We just did that. Okay. Now that we have clean hands, we're going to rinse. Don't touch the faucet or the sink. Your hands are clean. Those items are not. So keep your hands underwater, and that's it. Once you have rinsed your hands, you do not want to shake. This is what we do at home, right? We shake our hands. When you do that, you spread droplets of water everywhere. Now we've got warm, dark, moist. What we want to do is tap. That keeps the water within the confines of the sink. So we tap to keep our water controlled, not fling. Once you've tapped the excess water off, then you can get paper towels. Spoiler alert, it does not matter how many paper towels you use. Does not matter. There are some instructors out there that try to overcomplicate things to make themselves look much more intelligent and competent than their students. I am not that kind of a person. I want you to know more than me. I think that makes us a success. I don't care how many paper towels you use. It's not a graded checkpoint. Drying is. Just get what you need and dry. If you got small hands, use 2. If you got big hands, use 8. I don't care. Nobody cares. Just dry them. But when you dry, only dry what's clean. Dry what's clean. Don't dry up here. Did you wash up here? If you dry up here and then come down here, what did you just do? Yeah, you cross-contaminated. That's right. Notice that the water is still running. We have not turned that water off yet. So we tapped, we dried, we threw our paper towel away, our water is still running. And those water conservationists out there, you're going to just keel over this. But you cannot touch that faucet at this point. If you use a wet paper towel to turn that faucet off, that wet paper towel is likely to rip, and that faucet is the dirtiest thing in the bathroom. You will accidentally recontaminate your hands and take that contamination to your patient who does not have an immune system that can fight it off. Good? Make sense? So we're going to dry our hands, throw that away, get a clean dry paper towel to turn our faucet off, and this is a graded checkpoint. And then we're going to throw our paper towel away. All of these steps on the checklist are about to be shown to you in the video. And I know I'm hurrying, guys. I'm sorry. I'm going to show you the video. The video takes less than 2 minutes. But at the bottom of the video, you're going to see the actual checkpoint as I perform the step. So you're going to see me do it on the screen. And below that, you'll see the written checkpoint. Jake? As I approach the sink, I can touch the faucet with my unclean hands because the faucet is not clean. I'm going to turn the water on to a comfortable temperature and wet my hands thoroughly. You must rub with friction for at least 20 seconds. I'll get enough soap to produce a nice rich lather and bring my hands together to start timing. I'm going to rub the tops of my wrists on both sides, the back of my hands, interlacing my fingers, in between my thumb and index finger, making sure that I cover all areas with sufficient friction. The bottom of my hand by my pinky and the palm of my hand. After cleaning my hands, I'm going to go down my fingers with my thumb to clean the cuticles. I'm going to circle my nails on the palm of my hand and then rinse. Being careful not to touch the faucet or the inside of the sink. After rinsing, I'll tap to keep the water confined in the sink and then dry my hands thoroughly with paper towels, being careful not to touch the unwashed portion of my lower arms. I'll throw those away and get a clean dry paper towel to turn the faucet off because wet paper towels may rip and contaminate your hands.